I'll go over with a few minutes. What is the introduction to yoga therapy? All of you are in a yoga teachers training course. Are you going to be graduating at the same time, or you are staggered? You're graduating in different timing.
I'm not sure who's on this particular call, but some might be staggered, but a lot of us are all together.
Okay, and when do you graduate?
At the end of this year in December.
Great, okay. The reason I'm going to go over with you, why do you want to know about yoga therapy? So today we'll talk about called introduction of yoga therapy. And the plan is, after we get to know each other, I introduce the subject to you. We'll go to a Facebook Live. And this was, I've been doing it every Saturday. So when you are interested, you can come. I will have a yoga therapy class every Saturday from 9:30 to 11:30. And most of the classes, what I do, I give enough the reasons, causes, why you are doing it. So, and primarily it is for your yoga teachers. We'll finish around 11:30. We'll take a little break, about half an hour break. Come back around 12, and I will have the slide presentations to show it to you. What is in yoga therapy? Why do we need to learn yoga therapy? And where we are in yoga therapy. One of the most important concepts of yoga therapy you will see will be our digestion. The digestion, because in yoga, what we talk, the most important function of our body is the digestion. We just generally say term, we are what we eat, but in yoga, I will say we are what we digest. What is yogic digestion? How do you digest? What do you eat? How do you know you're eating right kind of food? How do you know how to adjust your diet? So we'll talk a little bit before we finish, and we'll give you a little lunch break. And lunch break will be a little long. And the reason is when we are doing in person, we are doing the same long lunch break because during lunch, we discuss about the digestion, and we want to give you a little time because we will do some practice, primarily pranayama and meditation practice this afternoon after lunch. And we talk about that we practice with our empty stomach in the morning, but if we have a full meal, then we generally wait about 2, 3, preferably 4 hours, 3 to 4 hours before we do our practice. So we'll take a break between 1 to 2:30, come back in 2:30. And I think you have all the timing schedule today. And I will have some timing for you for question and answer. Then we practice pranayama and meditation, we'll finish. Now, the first question is why you are or you want to know about yoga therapy. Primary reason is if you finish a yoga teacher's training and you say, I want to be a yoga teacher and I want to work as a yoga teacher in XYZ place, and I can guarantee you 75 to 80% people who will be coming to your class will be primarily for chronic diseases. I have hypertension, I have a chronic low back pain, I have a neck pain, I have a knee pain, hip pain, I have diabetes, I have a heart disease, I have a severe pulmonary disease, I have asthma, COPD. And the reason is the word is out. The word is out that yoga therapy helps in chronic diseases when I talk about acute diseases, acute disease, obviously we go to our hospital, we call it Western trained healthcare providers. And this is a new branch of our medicine, and it is called integrative medicine. Integrative medicine, we call integration of the philosophy of yoga therapy with the science of modern medicine. And the way to integrate is to understand first what yoga is, and also just let you know, and maybe 10, 15 years back, only maybe 3 out of 140 medical schools in this country had a department of integrative medicine. Today, almost 100 medical schools has a department of integrative medicine. Almost 65 medical schools has a fellowship program for integrative medicine. 25 of them has a full training program for proper certification. And in 2014, American Board of Medicine has started called the American Board of Integrative Medicine. So there are also physicians who are certified, who are board certified in your integrative medicine. Now, as a yoga teacher, first question is going to be asking to all of you, or you'll be asking to yourself when the people are coming, asking, what is yoga? Define yoga, definition of yoga. The way you will define yoga as a yoga teacher is that the word yoga means union. It comes from a Sanskrit word called yo, union. It's union of your body, mind, and spirit. It's a philosophy. The philosophy is called Yoga Sutra of Patanjali. Patanjali is a person who wrote it down. This used to be a called oral tradition from teachers to the students, and it was transmitted in oral tradition. Patanjali wrote it down. The sutras are called as small aphorisms, 196 sutras, of which 193 are to quieting down your mind. So mind is the most important concept of yoga. The practice is called Patanjali Ashtanga Yoga. Ashtanga Yoga means 8 limbs, and you have to, literally as a yoga teacher, have to memorize all the limbs. The first yam, niyam, social restraint, personal restraint, asanas. Asanas alignment, both external and internal alignment of your body and organ. Pranayama, pranayam. Prana, yam means control, restraint of your breathing. Prana is the breath is the carrier of prana. Pratyahara is control of your senses. Pratya means reject. Ahara means your input, all the input through your 5 senses. Dharan is the focus. Dhyan is a meditation. And 8th limb is called Samadhi. It's a union of your body, mind, and spirit. So always remember, the whole outcome is your meditation. People always say, I want to do a meditation. You really don't do a meditation. What you do, you prepare your body, prepare your breath, prepare your mind. You enter into a state of meditation. So we have this tool that called the philosophy, and we have the tool is called the 8 limbs. So yoga therapy, the definition of yoga therapy is an adaptation of these practices based on your clients or your patient's clinical condition. What does it mean? It means that a practice of yoga, even you start with the asanas, go to pranayamas, go to the pratyahara, go to the dharana, they go to the hand. And it's a stepwise practice to achieve your meditation, 7th limb. And finally, Samadhi is the 8th limb, union of your body, mind, and spirit. But in yoga therapy practice, you may have a client or a patient who is not able to even have any posture. They may not be able to sit down even in a ground where most of you are sitting in a ground. So you start, you look at the person, said, okay, sit down in a chair. And we'll show it to you during our practice, how to start a yoga therapy practice for a person who is just starting. So it's called adaptation of the yoga practices based on your client's clinical condition. As long as you understand that, then you will understand what we do during the practice. So I'm going to go ahead and set up. This is what, almost 9:16. So if you have a place to practice, you put it in front of your, if you're using a cell phone, put it in front of your cell phone, or if you're a laptop, in front of your laptop. And then I'll have to go in a different station where I have a laptop and I have a mat over there. I'll start over there. And I also have a chair. So we'll sit down in a chair and see how to introduce that subject. Any questions so far? What you said? If not, let's go ahead, get ready slowly. I'm going to close it down here. I go to Facebook Live and then come back and start with the Zoom again.
Good morning. This is our scheduled Saturday morning yoga therapy class. Today, I'm also teaching a course on yoga teachers training for National Yoga Academy of Virginia Beach. All of our students have joined. They're getting certified as a yoga teacher, but one of the topic is yoga therapy. So today is going to be the whole day. We start 9 o'clock in the morning. We already have an introduction. What is yoga therapy? We'll have a practice of yoga therapy. Then for the students, we'll have a little break. And then from 12 until 4:30 to 5 o'clock, we have a class through the Zoom with a little lunch break and discussing the yogic concept of digestion. Now for the students, what is more important? They were going to be yoga teacher. So what is their interest to learn about yoga therapy? The most important reason is if they finish the yoga teachers training program and they become a yoga teacher and work in any setup. It could be yoga studio, it could be in a healthcare setup. Almost 75 to 80% of the new people who are coming to that setup will be coming with a chronic diseases to receive yoga as a therapy. Why? Because the word is out. Word is out. There is enough documentation. Like for our healthcare providers, we look at the National Library and their search engine is called a PubMed. And if in a PubMed, if you put today a topic like yoga therapy, you'll get about over 5,000 articles. Interestingly, they separate meditation, but as you know, meditation is the seventh limb of yoga. But if you put a meditation, you'll get another 7,000 articles. So we'll say about 12,000 articles will come up in an established medical journal. These are not throwaway journals, established medical journals. If you go to NIH website for the research or for the funding, You'll see yoga therapy, if you put a funding, you will get over 450 or close to 500 studies being funded. And same way as meditation. So 800 to 1,000 studies being funded by NIH. And this is a part of our called integrative medicine. Integrative medicine is an integration of philosophy of yoga therapy with the science of Western medicine. Integrative medicine is being just starting maybe about 15-20 years back. About 15 years back, maybe about 3 or 4 medical schools in the United States had a department of integrative medicine. Today, probably about 100 out of 140 medical schools has a department of integrative medicine. 65 of them has a fellowship program, 25 of them has a full fellowship leading to the board certification. In 2014, American board did a separate board for the American Board of Integrative Medicine. Now the physicians are getting certified in integrative medicine. And if you know my book, which I'm going to show it to all the students. In fact, all the students got a copy of my book because this is almost like a textbook for yoga therapy. And if you see the name, it's called Yoga Therapy, Ayurveda and Western Medicine, a Healthy Convergence. And you see the picture of Albert Einstein, I call it Tagore, and it's called when a scientist meets a philosopher. So first definition is, what is yoga therapy? How do you define? But before that, how do you define about yoga? For a yoga teacher, the people will come and ask, what is yoga? Yoga is an anglicized word derived from the Sanskrit word called yog, which means union. It's a union of your body, mind and spirit. It's a philosophy. The philosophy is called Yoga Sutra of Patanjali. These are small aphorisms called sutras. It used to be an oral tradition from teachers to the students, and Patanjali is the first person who wrote it down. 196 sutras, of which 193 of them are to control your mind. The practice is called Patanjali Ashtanga Yoga. Ashtanga means 8 limbs. First is called Yam, which is a social restraint. Niyam is a personal restraint. Asana is alignment, external and internal alignment, our body and our parts. Then fourth limb is a pranayama. Pranayam, prana is your life force. Is it a subtle energy which keeps us awake, alert and alive? This life force is carried by your breath. Prana is like electricity and breath is like electric cable. Pranayama is a control and restraint of your prana. Fifth limb is pratyahara. Pratyahara means pratta means reject, ahara means your input. Input through your 5 senses, so you control your 5 senses. When you can control your 5 senses, you enter into a dharana, which is a focus. You have a focus in your mind, and slowly it gets defocused. If you stay in this limb for a longer period of time, you enter into the 7th limb, which is called meditation. It's a dhyan. And then once you're in the meditation for a little longer time, you enter into a state of called samadhi, which is the 8th limb, union of your body, mind and spirit. And this is a stepwise practice to achieve the union of your body, mind and spirit, and the balance of your body, mind and spirit. And yoga, the definition of health is called balance of your body, mind and spirit. And you will see we'll be doing a lot of balancing poses, and we'll show it to you how to do them. Now, yoga therapy is an adaptation of the same practice based on your client or patient's clinical condition. What does it mean? So a person comes with a chronic low back pain. you might start with some physical postures and show the person how to do the physical postures with the breath and how to achieve a relaxation response. Person might come with a respiratory problem, asthma, COPD, pulmonary fibrosis. You may teach them how to relax the physical body and then slowly start with a breathing technique. Or a patient might come with a neuropsychiatric disorder. You might decide to start even with a primary focus, dharana, or primary dhyan, meditation. You may start meditation. So able to determine which tool to use is a yoga therapy. And that's why the training of the yoga therapy is a lot longer than your training of the yoga teacher's training. The way we look at it, yoga teacher's training is like our primary care physician, and yoga therapists are the specialist. For the specialist, you need extra training. Now what we'll do today, we are going to show it to you that a person is being referred to you or referred to me as a yoga therapist who has no exposure to yoga before. And how do you approach and how do you bring the yoga therapy in their life and a day-to-day practice? For the yogis, the first practice in the morning is able to have a grounding poses, then get up, do a sun salutation, do a little pranayama, and do a little bit more spinal twist, grounding poses, and go back to work. But if you bring that concept to a person with a chronic disease, he or she will leave you right away because they're not going to be able to do it. So how do you do it? So person comes, you let them sit on a chair. Say, I have a chair behind me. I keep it all the time. And then we start a component of relaxation. Remember one thing, that there is a difference between an exercise and a yoga therapy practice. Exercise is a sympathetic overdrive. What is sympathetic overdrive? Our heart rate goes up, blood pressure goes up, respiratory rate goes up, muscle contracts, blood sugar goes high up, and it's basically called a fight or flight response. A car is coming to me or an animal is coming to me, it is our defense, how to protect ourselves. Either I fight, I need the energy, so my sugar goes up, heart rate goes up, or I run away, I fly. Still I need that energy. So it's a sympathetic overdrive, but what happens when the body has a sympathetic overdrive, body creates a parasympathetic activation. That parasympathetic activation is the effect of exercise in our body. So when we're exercising, we are not looking at how high my heart rate goes high up. I'm looking at what is my resting pulse rate. My resting pulse rate lowers down because of that parasympathetic activation. So this is called sympathetic overdrive followed by parasympathetic activation. But yoga practice primarily is a relaxation response, parasympathetic activation without getting into that sympathetic overdrive. Few signs you'll see, like I'm already having a sign, so I'm going to show it to you. Excuse me. Like when you have a sympathetic overdrive, when you have a fearful, your mouth gets dry. Because all of our gastrointestinal tract from mouth up to the anal sphincter is supplied by parasympathetic nerve. Sympathetic is called fight and flight, parasympathetic is called calm and digest. So I have a saliva in my mouth is wet. That's what I want to show it to you. I'm sitting down, even talking to you. I'm not drinking any water, my mouth is wet. Why? I'm having a parasympathetic activation, a relaxation response. So when a patient or a client comes to you, you want to initiate a relaxation response. You have a routine or a daily routine of which you start doing a relaxation of the different parts of the body, relaxation of your hands, relaxation of your wrist, your elbows, your shoulder, your neck, your back, your upper part of the chest, then hip, knee, ankle, foot. When you do the relaxation of your body parts, you have a state of called a sthiram sukham asana. Sanskrit word, but sthiram means stillness. Here I am, I'm sitting down in a cross-legged, this is called a sukhasana, but I'm still, I have a stillness. There is no fasciculation, my body is not doing like this. And how do you get it? We'll come to that again. How do you get it? You come in stages. What is the stage? First you start with a no pain. If you can sit down in the ground, it's well and good. If not, get into a chair. So let's go see if I can sit in a chair. And in a chair, and how do you sit down in a chair? So for a relaxation response, when you sit in a chair or when you sit in the ground, first thing you do, you keep your spine straight. You keep your spine straight. I'm looking all over, trying to see. Yeah, it seems pretty good. Okay, your spine straight. Even if you go to the back of the chair, still keep your spine straight. Body will be like a 90-degree angle. If a problem supporting on the feet, you can put a little folded blanket, you can sit down. Spine straight, and then your mind quiets down. The best way the mind quiets down is called your mudras. Mudras are called your health in your hand. As you know that when I talk, we always talk with our hands. Because whatever I think in my mind, it shows up in my hand. Something good, I say it like this. I want something, I do this. I'm listening to somebody, my hand goes like this. It's called a Hakini Mudra. Hakini Mudra, these are your Dhanu Mudra, Gyanu Mudra, your Chin Mudra. So you do a hand mudra. We'll talk about it. We have a big class on hand mudras. The universe is made of 5 elements. Space, air, fire, water, earth. 5 elements are also in my body, 5 elements in my hand. Space is represented in the middle finger, air is in index finger, fire is in the thumb, water in the little finger, and earth, grounding finger. So each touching finger controls your different disease process. This is touching your index finger and thumb, quiets down your mind. Very good for neuropsychiatric disorder, good for overall bringing the calming and cooling for your mind. So start with this. If you bend your index finger down, this is called a Vayu Mudra, very good for controlling your pain. So pain control. The pain is through called a Vata disorder. And then you touch in the middle finger and thumb, this is called your Shunya Mudra. This is your, improves your hearing. To a Prithvi Mudra, earth element, Prithvi Mudra. It is very good for your obesity, diabetes. And these are all in my book. So you know what I'm saying exactly what I have in my book. So all the students have my book, and you can always go back to the book and refer yourself. This is called your Varun Mudra. Varun Mudra is to improve your bladder function. So most of the good calming, cooling effect of the mind comes when you touch your index finger and thumb. You put it gently over your knees, then What keeps you pretty active is your 5 senses. So close your eyes. Then when you close your eyes, then you literally assess your body's function. Primarily you're looking for a pain. Any posture which creates pain, you back off. Even if this posture is causing pain, because you have never done a yoga. So sitting down causing pain, so you back off a little bit, have a little bit. Or if you cannot keep it straight, it causes pain, you just bend a little bit. Always listening to your body, but try to keep your spine straight. Then when you do a posture, like when you're grounding, just put it down. If it causes pain, you back off. Next is called your breathing, called effortless breathing. What does it mean? That if you create any imbalance in your physical body, it shows up in your breath. Your breath has to be completely effortless. The lung is like a balloon. It has a 4.5 liter capacity. That capacity is called a vital capacity. We only breathe 0.5 liter. So you have to learn first how to breathe out first. Slowly take a deep breath in and breathe out longer than breathing in. And you will be doing exactly what your body will allow you. Very, very important components. It is not competitive. You always listen to your body. So the components are the spine straight, sitting in a chair or in a ground, or putting yourself against a wall. You can always support your back against a wall and sit down with the spine straight. Hand mudra, this is called a meditation mudra, dhyana mudra, jnana mudra. Eyes closed, bringing your awareness to your breath. Breathe out first. Very easily you can take count of 2 in, 1 and 2 in, count of 4 out. 1 and 2 and a 3 and a 4 out. Generally what happens when you keep on doing it, you develop a habit. In medical terms, it's called neuroplasticity. And the muscles of breathing are also called skeletal muscles. That means they can be trained. They can be trained to have a better and better performance. So you will see, slowly and slowly you will be able to do count of 3 seconds in, 6 seconds out, 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out. We've been doing it for so long, we can do easily 10 seconds in and 20 seconds out. So let's do a practice. If you're sitting in a ground, what you will do, you will start with a, called a easy pose, Sukhasana. You put both the feet underneath your knees, cross along the line of your spine, keep your spine straight, touch your index finger and thumb, put it over your knees, be sure there is no pain, there is no discomfort. If you have a pain and discomfort here, you back off. Back off to the position where you're comfortable and stay in this posture. See, if you stay in the posture, because see, if you push it down, you're always going to come back higher. Stay in the posture and slowly this thing is going to happen. Then you will see in stages, slowly and slowly, we'll go to a deeper and deeper asanas. So let's practice with the breathing with the eyes closed. Let's start first breathing out, count of 2 in, count of 4 out. Then I will progress. I might go to count of 1, progress, and you find where is your level and you stay at that level. I will even go up to count of 10 in, count of 20 out, just to show to you how easy it is when you practice. Breathe out first. Count of 2 in, count of 4 out. Count of 4 in, count of 8 out. Count of 6 in, count of 12 out. Count of 8 in, count of 16 out. Next, you take both the hands together. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, it's called pumping and cupping. If you're wearing your glasses, remove your glasses. Take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face, massage your ear. Very important. Behind the ear, in front of the ear, auricle of the ear. We call it tragus, even an external auditory canal. The reason is there is a nerve called auricular branch of vagus nerve. A vagus nerve is a mediator of your parasympathetic tone. So you want to initiate parasympathetic tone. If you look at external ear canal, if you do a little bit of just a massaging, you feel a profound level of relaxation. Bring it down, massage your neck, both sides of the neck. There is an organ called carotid sinus. Carotid sinus is also helps for the baroreceptors, and also it helps in your parasympathetic activation, calming and cooling effect of your cardiovascular system, neurological system. Massages in the back and slowly come back again into your hand mudras. So it's a very simple way a person who is starting will be able to do it. Next, you create a vibration. A brain is a state of vibration. You create a vibration. That vibration quiets down your mind. Yoga gave us a sound called Om, which has a component of A, U, Ma. A comes from the lower part of the lung. U comes from the middle part of the lung, Ma comes from the upper part of the lung. When you do that A, U, Ma, you also develop a profound level of relaxation. Another practice is called a bumblebee breathing, called Bhramri Pranayam. In a Bhramri Pranayam, you shut down your 5 senses. Then you breathe out through your nose, breathe in through your nose, breathe out with the sound of a bumblebee. That has a profound relaxing effect in our body and mind. You need to practice on that. So, going back again, the step by step. Sit down in the ground or in the chair with your spine straight, eyes closed, hand mudra, or hand gesture, breathing, exhalation longer than inhalation. Always remember in any yoga practice, exhalation first, because the lung is a balloon. If you inhale, this air is sitting on the top of that dirty air which is already sitting in the lung. So you need to remove the dirty air first, make some room for the fresh oxygen to come in. Always breathe out first. Always breathe through your nostril. Your nose is like your personal air conditioner. It filters your air. If outside air is warm, it cools it down. Outside air is cold, it warms it up. It goes into the side of your nostril called a turbinate, and the air goes directly into your lung. In the process also it secretes nitric oxide from your nasal mucosa. Nitric oxide is a powerful mediator of your parasympathetic tone, the relaxation response. Nasal breathing creates a relaxation response. So if you breathe through your mouth, you don't know where the air has gone. It could go in your stomach, part has gone to the lung, but if you breathe through your nostril, all the air goes to your lung. So let's to the last component, which is a closure of the five senses and creation of vibration, bumblebee breathing. We'll do two times. Let's do it together. Take your index finger, put it in between your eyebrows, called the third eye. Use your three fingers to close your eyes. Use your thumb to close your ear and close your mouth. You have shut down literally your vision, your hearing, your smell, and the taste. You breathe out through your nose first. Take a deep breath in and breathe out with the sound of a bumblebee. Again, do one more time, palming and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, you take your glasses off, make a cup, put it over your eyes, massage your forehead, massage your eyes, massage your face. So for the whole upper body, with relaxation. I have a DVD called Yoga Therapy for Health and Healing. In that DVD, you have the chapters. Each DVD has a chapter, and my DVD is also in a YouTube. And in each chapter, and you can go into the relaxation, steps of relaxation, and it is so beautifully written it down. If you can, you may not be able to see it that well, but you will see that it's called. They did it for you. It's called the steps of relaxation. Asanas for relaxation. Relaxation of the small joints of the upper extremities. So, if you can get one of these DVDs, you will be able to see all of them, the step by step. So now, what we find out, a person who comes in, you can start with him very simply, even sitting in a chair or sitting in the ground. If you sit in a chair, first the hands get relaxed when you close it like a baby. This is the baby closes the fist. This is called the baby fist, also called Adhi Mudra, Sanskrit name. Wrist gets relaxed with a called extension. Wrist tightens up with a flexion. Elbows gets relaxed with turning inside, called internal rotation. Outside one causes pain, like I call a tennis elbow. Shoulder gets more pain with what I call abduction, when you raise the shoulder high up. But adduction, coming down, shoulder causes a little bit of relaxation. Is this called external rotation, tightness of your shoulder? And for internal rotation, relaxes your shoulder. Neck is very tight. You do that 4 different movements of the neck, back and forth, side to side, look at the back and rotate your neck. It's a big name, it's called a Brahma Mudra, Sanskrit name, but it's called the 4 stages, your rotation of the neck. All this thing can be achieved with another posture called prayer pose to the back. That you put a hand in the front. If you do a prayer pose to the back, slowly and slowly, I will show it to you. You can do it when sitting in a chair. You can do a prayer pose to the back, then slowly do the neck relaxation with a breathing. Like you breathe in first and breathe out. Okay. Let's do the practice together and see this in one pose, your whole upper part of the body will get relaxed. Always remember, when you get into any pose, in asana pose, the first muscle contracts to get you in. But if you stay in the posture a little longer, with your breath being completely effortless, muscle cannot stay longer contracted too long or start to relax. Before relaxation, it causes fasciculation. It's called stability. Finally get a profound relaxation. The stages of asanas. Another very important thing to start with the yoga therapy for a person who has not done is called balancing. See, I was sitting down like this. I will teach the person how to cross the leg other way and sit down. And if you're doing it, you will see you always feel more comfortable in one side than the other side. Why? Because you're naturalized. I'm using right hand, I'm using right foot, I'm using my left brain. I'm not using the part of my right brain at all because I'm clumsy. So always try to use a non-dominant hand. Try to use it. Try to brush your teeth like this. Try to eat food. Use your fork. You'll see when you start brushing your teeth, initially the brush will never come close to your mouth. By the time it comes close to your mouth, you'll see your other hand goes like this. Because your brain knows you brush with your right hand. Also, I'm sitting down here, not that I want to sit down, my brain allows me to sit down. So, doing the balancing on the both sides. So if you're sitting in a chair, what you can do, if you're sitting in a chair, you sit in a chair, your feet is pretty grounded, you can take one foot and put it in over there. If not, even you can put a little stool here, support your feet, but try to move your joints. In yoga therapy says, the body needs movement and mind needs stillness. And stillness comes from the relaxation response. So I'm here for a while. When I'm a little bit uncomfortable, I go back, I put it in the other side. So alternate that you will feel that the way you can use your right hand, you'll be able to use your left hand equally. That brings your balance, that brings your health. Also, I'm very comfortable in this posture now, relaxation. I progress. I take my heel to the back. I take my one foot in the top and my knee drops down. If you're practicing with me, try this. This is called your perfect pose, Siddhasana. If the knee doesn't come down, don't worry. If the knee is here, let it be here. You stay in this posture, do your breathing, slowly and slowly it will come down. If you push it down, it will always come back higher. So let me show it to you how to do the prayer pose to the back. Let me turn around so you will see, and you'll be able to hold in that posture. The first, you take both the hands to the back. If you can bring it here initially, good enough. If you can put it together, if you can put it as like a prayer pose, it is better. Then you close your eyes, do your breathing, breathing out longer than breathing in, and breathing out, as I said, is a relaxation. Parasympathetic, breathing in is sympathetic. Your spine is straight, you're breathing slowly, and your hand will say to slowly keep on going high up and up and up. More and more you get relaxed, higher and higher it will go high up. And in this posture, my hand, my wrist, my elbow, my shoulder, all of them are relaxed. So after the initial relaxation response, you start with your prayer pose to the back. To open up, even if you open up your chest, the better breathing. The moment you have a better breathing, you'll see your asana practice gets better. Now, I'm comfortable a little bit, so I can progress, and I want to show it to you how to progress. And I take my one foot on the top. This is called half lotus, Ardha Padmasana, half lotus. But if the half lotus causes pain, or this is also called a swastika asana, like a swastika, if it causes pain, you back off. Even if it causes pain here, you can back off here. But start somewhere. If you don't move your joints, don't move your body, you will never achieve that relaxation response, never achieve the therapy for the chronic diseases. When you initiate a relaxation response, your blood sugar comes down, your heart rate comes down, your respiratory rate comes down. We have done it. See, we have this. This is the thing I always show it to people. This is an Apple Watch. When I'm doing it, it's recording. It's recording my EKG, recording my heart rate, recording all my body functions. So you know exactly what we are doing. So we know exactly how my body functions. We know the effect of yoga in my body. So here am I. I'm putting my hands to the back as a prayer pose to the back. So I'm guiding you, so taking a long time, but when you practice, it is a very simple practice. Initially I tell you, you practice whatever time you have, slowly and slowly, when you feel better and better, it's almost like addictive. We request you take 1 hour of practice in the morning, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. It's like a prescription for a patient with chronic diseases like chronic low back pain, all the joints pain, knee, hips, neck pain, diabetes, hypertension, heart disease, high cholesterol, gastrointestinal problems. These are all being corrected with 1 hour of yoga therapy practice. Now you will do 4 postures of the neck, and I always like to do it with my eyes closed. When my eyes are closed, I clearly see my body, which is called a subtle body. Gross body, subtle body. Subtle body is the body of your mind. Then another we call a causal body. Causal body is the body of your spirit. We have 3 bodies, we have 5 layers called koshas and 7 chakras. We need to balance all of them. So I will do the neck movement with the breathing. The way I do it, I breathe in first, drop my neck to the back, and in breathing out, I create a vibration. On breathing out, I create the vibration of the bumblebee. So let me show it to you. I do all the 4 postures, and you will have a profound level of relaxation. And at that point, you will see your breathing completely effortless. You'll be able to breathe in 6 seconds in, even 12 seconds out. Slower and slower your breathing, longer and longer your longevity. Longer your exhalation, longer your longevity. As simple as it is. In animal world, animal who has a slower breathing rate, they live longer. Higher breathing rate, they live less. So breathe out first. My eyes are closed. Breathe in, slowly drop your neck to the back. Breathe out with a sound of a bumblebee. What you have noticed, when you put your neck in the front, there should not be any pain. If you feel any pain, you slowly back off. Then you have effortless breathing. When you're breathing, the breathing should be completely effortless. If you have any effort in breathing, that means you are creating a imbalance in your physical body. See, my hand is in the back. I'm already feeling relaxed. I can push my hand a little higher up again. I can see the stages are coming. Relaxation is setting in. One more time. Breathe out first. Breathe in. Put your neck to the back. Just practice with me if you're doing with me. Breathe out to the sound of a bumblebee. To side bending on both sides, same breathing technique. Breathe out first. Take a deep breath in. Third, you look all the way to the back without turning your shoulder on both sides. Same breathing technique. Breathe out first. Take a deep breath in. Finally, rotate your neck with the same breathing technique. First to the left, to the back, to the right, then right to the back to the left. Drop your head down. Breathe out first. Take a deep breath in. wonderful practice. This is the beginning. You relaxed your whole body, and that's what yoga therapy is. Yoga therapy says, okay, one more thing. Since I feel a profound level of relaxation, I'm changing my foot now. I take my other foot on the towel, and you are looking at how simply we're progressing. We call yoga therapy is the art of transformation. It transforms a person with a disease, a patient, into a healthy person, and then into your person who's practicing yoga, called yogi and yoginis. The art of transformation. It's very, very important. And you always practice, this is a daily practice. This morning I'll be doing mostly asana practice, and in the afternoon for the students I will show a breathing pranayama and a meditation. For the rest of the people who are in my class regularly, we have seen the pranayama practice. In fact, yesterday I did another pranayama practice. And I'll show it to you. Now, how to relax? See, in this posture, I'm relaxing on the wrist. Now, look at how simple it is. I'm so relaxed, I can take my other foot, bring it up, I can sit down. This is called your lotus pose. So I could get into the lotus pose first, but I did not. Why? I went in stages. And these are the stages your patient, you're going to bring your patient in stages. It will take some time. Remember one thing, yoga therapy is not that is a one consultation. You will have one consultation, then the person will keep on coming to you, and if you do a class like me, which is like a once a week in Saturday, then I tell them, please practice at home. It's a daily practice. You have chronic disease, you take a daily medication. You take a medication for your diabetes, for your heart disease, for your pulmonary problem. You take a daily medication. So, instead of daily medication, do a daily practice of yoga therapy. And we have a tremendous amount of experience now. It causes a proper control of your chronic diseases, prevents progression of the chronic diseases. Sometimes it causes complete reversal of the chronic diseases. It gives it better quality of life, and it reduces pharmaceutical support. So I'm so comfortable sitting here. Then one another was called the Yoga Mudra, like trying to put your body in the front as a relaxation. It may not happen initially, it may take some time, but when it comes, it is a profound relaxation. Plus, it causes your spinal flexibility. In yoga therapy it says, you are as young as your spine. Flexibility of the spine is a health, rigidity of the spine is a disease. See? It's a disease when you spell D-I-S space E-A-S-E. You hold your left hand to the back, keep your spine straight. The way to keep your spine straight is look straight. Always do it with effortless breathing. People always ask me, when do you breathe in, when do you breathe out? Yes, there is a technique. Before a muscle contracts, you breathe in. When the muscle contracts, breathe out, because the oxygen is here, muscle needs oxygen. But normally, you want to breathe in and out, breathing out longer than breathe in. So breathing out first, and as I say, I always try to do it with my eyes closed, which brings a better relaxation. I'm breathing out first, taking a deep breath in, slowly dropping my body down. I'm listening to my body's signal. There is no pain, I keep on coming down. My breath is effortless. I keep coming down. If I have a pain in this posture, I back off. I back off, but I stay in the posture. How long? Between 5 to 10 breaths. If you can stay in a posture between 5 to 10 breaths, you progress very rapidly. My breath is good. Breath is effortless. How do you know breath is effortless? You can talk. You can even sing. You can do every other work with your breath being effortless. If your breath has an effort, you won't be able to do any functional asanas. So if you can come all the way down, of your head touches in the ground, you stay here between 5 to 10 breathing cycle, and the breathing is breathing out longer than breathing in. As simply as count of 2 in, count of 4 out, or count of 4 in, count of 8 out. You see the posture? I'm talking, I'm breathing. When my eyes are closed, I'm breathing, I bring a profound level of relaxation. Wonderful practice. In fact, for people who are advanced practitioner, you will see, by the time you can come up to this stage, you will feel a level of lightness. You feel like you are levitating. This is called your lifting asana, or tulasana. Tula means lift. Another was called a kukutasana. Crooked is a name, but let's just show it to you one. I'm putting my hands on both sides. I just simply push my hand down, my whole body goes high up. Body goes high up, body stays high up. I don't feel the effect of the weight of my body. So I'm talking, I'm breathing. That's a state you need to come in. By the time you need to come this state, you are essentially a disease-free. So now look at that. You have relaxed your whole upper part. Relax your hands, relax your wrist, your shoulder, your neck, your whole upper part, back. Many times you can do the shoulder also with a little called shoulder rotation. You can put your hand in the shoulder, bring your elbows together, and then again listen to your pain. If it hurts, back off. Find the place where you are comfortable and do the breathing. Breathe out first. Take a deep breath in. Slowly rotate your shoulder. Shoulder is called ball and socket joint. The more and more you do shoulder, better and better. Shoulder has one called a rotator cuff tear. Rotator cuff tear, do the breathing. Breathe in the middle, breathe out. Rotator cuff tear is not taken properly, it's called a frozen shoulder. Then the opposite side, breathe in to the opposite side, to the opposite rotation. When you do your breathing and the rotation, do with your eyes closed. I do it every single day. It's a wonderful practice. Doesn't take much time when you start doing it in the morning with the eyes closed and going step by step. You can also pull your hand behind your head. Very nice. Hold your wrist, breathe out first, take a deep breath in, slowly pull your hand down behind your head. Same breathing cycle. Do not stop and hold any breath. Breathe in here, breathe out, pull it down, and the same breathing cycle, come back in the middle. Breathe in, breathe out. Breathe in, breathe out. Let's look for the lower extremities. What you can do for the lower extremities. And you will be able to do same thing even in the chair. See the forward bend we did, if sitting in a chair, you'll be able to do it the forward bend from the chair. In a foot, what you do, you sit down with your called Dandasana. Let's see if I properly move the chair. Hands on the side, spine straight. So separate your toes. When you separate your toes, toe gets relaxed. Breathe in, breathe out. So always remember, when you can separate your fingers like a hand gets relaxed. You know, initially, when hands is not, they're very tight, they're relaxed, so it goes in and out. And you'll see also in the toes. Ankle, very important to relax because all the body weight comes to the ankle. So the breathing, breathe in, breathe out. Breathe in, breathe out. Slowly rotate, breathe in. Keep your eyes closed, you'll see with the eyes closed and with the breathing. Breathe in to the opposite side. Both sides slowly. It's a wonderful practice. Again, spinal flexibility is very important. Remember, yoga therapy say, I'm not interested about the disease you have, I'm interested about the whole person who has the disease. I'm taking care of the whole person. And also I'm taking care of it in stages, in step by step. So instead of me pushing, it's coming to me. You don't go for asanas. Asanas will come to you. How the asanas come to you? Prepare your body and mind with a relaxation response. You'll be able to do every asana. If challenging asanas, you've got a headstand, you've got to go a peacock pose, Mayurasana. You'll be able to do everything when you're doing this basic relaxation technique. Seated forward bend, Paschimottanasana. Take your hands and put it wherever it goes. If you can hold the toes, it's great. And you also can do it sitting in a chair. Keep your spine straight and slowly drop your body down, but keep your breathing effortless. Breathing out longer than breathing in. What you're looking for? Pain. If there is a pain, you back off. If you do it too fast, too rapidly, you can even develop an acute back pain. So always be careful with a seated forward bend. In a seated forward bend, you do not, remember, do not do suddenly and do very rapidly, do very hurriedly. Give your time and let the body sink down on its own. If it even comes here, stay here. See, for us, we are relaxed enough, we can put our hands, we can even clasp our hand. It's okay. Still coming down. Eyes are closed. Breathing out longer than breathing in. Essentially, head comes down. It touches your leg, and you stay here between 5 to 10 breaths. So when you're relaxed enough, what you need to do, be sure you need to get up one step at a time. Use your hand and let the hand guide you. It's a wonderful practice. You can do relaxation of the whole lower part of the body. What you can do, take your one foot And remember separation of the toes. Take your hands, take your fingers and put it in between. Initially it will be very tight, but slowly and slowly it will relax. And market is full of it. Yoga toes, yoga socks, yoga sandals, yoga shoes, and I have all of them. Somebody gave me all the gifts and I have, okay, I'll show it to you soon. So here what I do, I take my knee all the way high up. I'm hugging the knee. I breathe out first. Always remember in yoga practice, you breathe out first. Take a deep breath in. Slowly let the knee go all the way down. It will go down on its own. If it is not going down here, stay here. What will happen if you push it down? It will do like this. Knee is called site of fear, and hip is called site of emotion. You know, when you're afraid, what happens? The knee starts shaking. When I first gave a talk in front of a big audience, what happened? I had a shaking on my knees, but slowly and slowly it goes away. Stress is a fear of unknown. Balance it. Always balance it to the opposite side. Remember, yoga is a balance. Yoga therapy practice balance. The left hand is going in between the toes. See how easy it goes? In fact, ankle, you can relax your ankle. You can sit down and do it. And you can do this all the time. 24/7 practice. Bring the knee high up. Breathe out first. Take a deep breath in. My eyes are closed. And slowly goes down. So stress is a fear of unknown. I have a fear. If I go out, I don't know what will happen to me. Am I going to get COVID-19? That fear is a stress. Stress creates a hormone called cortisol. That cortisol creates your truncal obesity, or mental fat. Glucose converts into fat with the cortisol. That omental fat then starts secreting inflammatory molecule or pro-inflammatory molecule, which creates a diabetes, hypertension, heart disease. It's called metabolic syndrome. There is no risk factor for heart disease anymore. I have a heart disease today, tomorrow I'll have a diabetes. Or today I have a diabetes, tomorrow I'll have a hypertension. Today I have a hypertension, tomorrow I'll have a heart disease. As simple as it is. Hip is a site of emotion. Emotion-related disorder. All the neuropsychiatric disorder, emotion-related. Even our blood pressure, high blood pressure related to emotion. This is called your Baddha Konasana, closed angle pose. You put your feet together and slowly you bring close to you. If you can bring close to you, clasp your hand and slowly see, this is also called butterfly, Titliasana. You can slowly keep your spine straight, eyes closed. In a short time, you'll see both the knees are coming down. Initially, I can see I'm not touching the ground, but within a few movements, my knees are almost touching the ground. I'm breathing effortlessly, breathing out longer than breathing in. Hip pain will go away, knee pain will go away. Remember one thing, all the joint problem we have, the pain comes not from the bones, not from the cartilage. People say, oh, my cartilage is all broken down, all the covering is gone, I'm in pain. No, when your bone cartilage breaks down, when the body tries to splint, it tightens up the ligaments, it tightens up your muscles. So grounding poses, it's very important, grounding poses. Yoga is all made for grounding. It's called your thunderbolt, Vajrasana, able to sit down on a hill. So the way to start it, you can first sit down on your hill. Keep your spine straight This is asana is so grounding, so relaxing, and it creates again a parasympathetic activation. Parasympathetic that is called calm and digest. This is one asana we said you can do in your full stomach. After a meal, you do it. Slowly, you're able to sit down on your heel. If you have any issue on that, what you can do, you can take a little bit of a small pillow or a folded towel or a folded blanket. Many a time folded blanket is not better, because a folded blanket, you can put it here and slowly can come down. If you have a problem with underneath, you also can put it underneath your ankle joint and sit down. This is called Thunderbolt, Vajrasana. Very relaxing. It helps in your digestion because parasympathetic is called calm and digest. Next one is very good for your truncal obesity, diabetes, all the chronic diseases. It's called your frog pose, Mundukasana. Use your hand like a baby fist, the way the baby closes, thumb inside and close. Put it at the level of your belly button. You breathe out first. Take a deep breath in. Slowly breathe out and see if you can come down. How far you can come down. Come down and listen to your body's signal. What was your body's signal? No pain. Effortless breathing. Come down all the way. Your head comes down on the ground. Stay in the ground. And you're breathing out longer than breathing in. In normal practice, you do between 5 to 10 breaths. I'm showing you the technique so you understand. Remember, people calls me and tells me too many things to remember, too many things to look at. You know, this is all being recorded. This is all being recorded in your Facebook Live, and then it gets uploaded in the YouTube. You go to my YouTube channel, Dilip Sarkar Yoga, and all will be there. These are all in my book, all in my DVDs, and I always try to share the same asanas, same pranayamas. I do a pick and choose for different diseases, but I do not introduce anything new, because I want you to practice the same asanas, same pranayamas, different sequences for different diseases. So that is the adaptation, of yoga therapy. So comfortably sitting in a thunderbolt pose. It's a profound relaxation. From here you can do what is called your rabbit pose, or a moon pose, Shashankasana, Sanskrit name. I know your students, you're just starting, so you may not be very comfortable with the Sanskrit name. In fact, Amanda already told me that go very slowly with the Sanskrit name. I'm not pushing you to the Sanskrit name. I'm always telling you the English name. But if you understand the Sanskrit name, remember, there is a lot of lost in translation. If you understand the Sanskrit name, you'll understand that asana so well that you will be able to practice it. So rabbit runs around, slows down. So take the hand all the way high up, push it all the way down as far as it goes. Take the elbows on the ground, and again remember breathing out first, breathing in, and slowly drop your head down, touch your head to the ground, and stay here. How long? At least 5 to 10 breaths. And when you get up again, be sure you walk on your hand and slowly get up one step at a time. Spinal twist is very important. For the diabetes, these asanas are very good for your diabetes. Diabetes because it ignites your digestive fire. It's called Agni, Jathar Agni. It massages your pancreas. Pancreas is way deep in your abdomen. It's very close to your spine, the vertebral bodies. So when you do the spinal twist, you literally massage the pancreas. You get more insulin out. Massaging the organ makes the organ more functional. As simple as it is in yoga practice. You'll see anywhere you can massage your organ. A thyroid, you can do all the massages. You can do a fish pose, you can do your shoulder stand, you can do your camel pose, you can do even your cat pose, or even could do a pranayama. Thyroid, so massaging your organ. So let me show you how to do some spinal twist. Let me move the chair a little bit. So I'll come back to the chair to show you more asanas on the chair, because we are all patient. We're doing a yoga therapy at the beginners. Slowly you do, it's called a spinal twist. Sanskrit name is called Bakrasana. Bakrasana means you're twisting yourself. So if you're doing with me, practice a step by step. Take your right foot close to your left thigh. Right knee goes a little bit towards your left side. Left arm comes out. It goes outside your right knee. Right hand goes to the back. Left hand's up here, slowly comes down, touches outside the knee. You breathe out first. Take a deep breath in. Slowly turn your body away from you. And you will notice at one point, you'll catch your breath. So before you catch your breath, you stay in the posture between 5 to 10 breaths. Effortless breathing and no pain is the art of yoga therapy. Written down in your mind, no pain, effortless breathing, and in stages impossible become possible. You will never have any problem with practicing yoga therapy. Always balance on the other side. This time, left foot comes close to your right thigh. You love it, hugging. It's a baby. You're hugging it. Slowly bringing the baby. Left knee going towards your right side. The right arm comes outside your left knee. Left hand goes to the back. Right hand slowly drops down, goes outside your right knee. Keep your spine straight, look straight. Breathe out first. Take a deep breath in. Look all the way to the Again, breath should be effortless, If you're practicing with me and a little bit more advanced poses, we'll do a called a cow face, Gomukhasana. You will see the cow face, your whole body, total body get completely relaxed. And also you pick up sitting down poses, laying down poses, face down, face high up, some standing poses, and go one step at a time. You can do a little bit of further extension of this asana, which is called, in English translation, that is called lost in translation, called half Lord of the Fish pose, called Ardha Matsyendrayanasana, big Sanskrit name. It's a name of a yogi and it comes from there. So you have one knee in the top of another one. This is the beginning of called a cow face. The reason it's called a cow face, if you look at it, it looks like a cow face. The yogis look at the nature, and the nature they gave the names. Right foot comes next to your left knee. Right knee goes towards your left side. Left arm comes outside right knee. Right hand goes to the back. This hand slowly touches your knee, then the ankle, then your foot. Again, breathe out first. Take a deep breath in. Slowly turn your body away from you. 5 to 10 breaths. Half Lord of the Fish pose. Opposite side, same thing. Now your left knee, the top of the right knee. Left foot up comes outside your right knee. Left knee is slowly coming towards the right side. Right arm goes outside your left knee. Left hand goes to the back. Right hand comes to the knee, ankle, and then at the foot. Breathe out first. Take a deep breath in. Slowly turn your body. Release your hand. This kind of spinal flexibility bring your health back, and that is really a treatment for yoga therapy. Now you do your cow face Gomukhasana, touching your hands to the back. I'll be showing the other way around so you'll understand what I'm saying, and you will do the balancing of both of them. Now I'm putting my left knee on the top of my right knee. Left hand goes high up. Right hand comes here. I stabilize my right hand. I drop my left hand down. I touch it, hook it. I literally handshake each other. It's a wonderful practice. Now you see the difference. Now I'm doing the opposite side. Now my right knee is in the top of my left knee. Right hand is up here. Left hand goes here. I put my left hand in the middle, stabilize it. My right hand comes down, it touches, it hooks. It's literally handshaking. And you're seeing both sides is equal. When you're in imbalance, one side becomes easier than the other side. So these are the practices. And once you do the practices, you do some standing up, but this is one yoga practice which will come to you slowly and slowly. It's a wonderful practice. You will be able to sit down in a, call your squatting pose, Malasana. Here, your ankle, your feet, your knee, your hip in the back, everything is relaxed. You put your hands together, separate your fingers. It's a wonderful practice. Put your one elbow inside, other elbow inside. Slowly bring your hand in front. Keep your spine straight. Close your eyes. By the time you do it, nothing will come in your way. From here, if you want to get up, it is called sit, rise, test. Very, very important yoga practice. Able to get up without any effort. Sitting down and getting up. Going against the grain of your habit is yoga. So you're comfortable standing like this, so if you can put your feet together. Bring the balance. Health is a balance of your body, mind and spirit. When I fall down in my hand. Also I balance with my eyes. So if you can do balancing pose with the eyes closed, that is a wonderful practice. So for the hands, so let's take the hands away. Hold. Right hand holds your left arm. Left hand holds your right arm. Putting your feet together. See if you can stand on a non-dominant foot. I'm right-handed, right-footed. See if you can stand on my left foot. Keep counting. 10 seconds, 20 seconds, 40 seconds. And close your eyes. If you close your eyes, see if you can stay. If you can close your eyes and stay on one foot, it's literally a healing material. I do it every single day, but still I cannot do it. It's a wonderful practice. If you can do about 20, 30, 40 seconds, it's good enough. Change your hand again. Use your left hand to hold your right arm, right hand to hold your left arm. And so if you can stand on the other foot. Close your eyes. By the time you can do it, this is your yoga. Because not able to put your body in a pretzel. This is you. Balancing, like you cross your feet. Balancing both sides of your brain. Cross your feet, so if you can sit down crossing your feet, and getting up crossing your feet. Try it. Try it when you're practicing with me. To the opposite side. Sit down. Get higher. Spinal flexibility. Mountain pose. Always keep your spine straight. When you stand up, your ear, your shoulder, your hip, and the ankle in the same line. Clasp your hand, go high up, put it over your head. See if you can stand on your tippy toes. Breathe out first. Deep breath in. Slowly see if you can get your toes and go high up. It's called upward mountain pose. Utthita Tadasana. Very powerful asana for your proper elimination. You can do the same one on the side. Called oblique mountain pose. Breathe out first, take a deep breath in. Slowly go to one side. Go to one side, and then again come back in the middle. And stay in the pose. That is very important. I'm showing it to you, but at home, when you breathe out first, take a deep breath in. When you come down your posture, even if you keep your eyes closed, keep doing your breathing. Breathing out longer than breathing in, and see how long you can stay in the pose. And longer you stay, you will see your body will be diving it more and more. It's a wonderful practice. West rotation pose. These are all called asanas for your proper elimination, to bring your health back. Separate your hands. Right hand goes over your left shoulder. Left hand goes to your back. Breathe out first. Take a deep breath in. Slowly twist your body away from it. Bring it back here slowly. Same thing you do. Left hand on the right shoulder. Right hand to the back. Breathe out first. Take a deep breath in. And slowly twist your body on the right side. Massaging all the contents of your abdomen. Massaging your abdomen is the yoga therapy. Here, all the disease is here. After vital organs, here. Stomach, liver, spleen, small intestine, large intestine, uterus, tubes, ovaries, prostate. These are all we're massaging it. You can do the hands in the front. Breathe out first. Take a deep breath in. Slowly twist your body all the way to the back. Bring it back slowly here. Breathe in. Breathe out. Do with your eyes closed. You will feel a profound level of relaxation. In fact, it is so relaxing. This is called a moving meditation. Separate your feet as much as you can and put your head down. When you put your head down, head below your heart is a wonderful practice. It causes the pressure inside the head goes higher, pressure inside the eyes goes higher, pressure inside this carotid artery goes higher. You cannot breathe, you cannot talk, you cannot perform, but more and more you keep it down, the body's homeostasis comes in. Your pressure inside the brain goes down, pressure inside the eyes goes down, face goes down, and you feel a profound level of relaxation. That is the beginning of your inversion poses. When you do inversion poses, even if your shoulders stand, head stand, it's a profound level of relaxation. It is so relaxing that first you do a supported forward bend. You put your hands on your thigh, slowly support yourself and drop your head down. And wherever you can come down, stay here. But for us, we can keep separating our feet. This is called your split Hanumanasana. You can do all the way or stay here up to the width of the mat. Put your head down. My head is down. I'm in a profound level of relaxation. In fact, I can do all the pranayamas, which we'll do this afternoon. I can do Kapalbhati pranayama, I can do Vastrika pranayama. It's a wonderful practice. Always remember, the way you do the yoga therapy practices, you are in a totally state of relaxation. That means each asana is your savasana. You don't need a relaxation of asanas. Standing up, then you do, call your sun salutation, then a cooling one called a moon salutation, but sun salutation has the 12 steps, and you do with a breathing. We do with a breathing. So let's say for people who just came in, let's do it sitting in a chair. We call that sun salutation in a chair. And let me show it to you. And all the asanas we have done, you can do sitting in a chair, sitting in a chair. So sun salutation has a 12 asanas, also has a 12 mantras. Mantra, man is a mind, tra is a quieting down. creates a vibration, quiets down your mind. It has the 12 names of your sun. Then it starts with the breathing called therapeutic sun salutation. First you put your hands together. This is the name, your prayer pose, pranamasana. Then you raise your hands high up. It's called a hand raising pose. Then you put your hand down. I will do it all of them. You'll see, you put your hand down, and when you're doing on the floor, you will do the next is your call. Push your one foot to the back. It's called a horse riding pose. Also Sanchalanasana. And do it with each breathing. If you start with the breathing in, then you'll be breathing out, then the breathing in. All of your breathing will alternate breath. If you start with breathing in, you'll end up with breathing out. Then it's called a Parvatasana, mountain pose. Then you get down on the floor. It's called your touching the floor, Ashtanga Namaskar. Then you get up into called a cobra pose, Bhujangasana. Then go back to your mountain pose. Then you go to call a horse riding pose, Asa Sanchalanasana. Feet touching your hand touching your feet, Padahastasana. Hand raising pose, and in the prayer pose, Pranamasana. In the sixth one, it comes back again in the same asanas. From 7th onwards, they repeat the same asanas. So let's see how you can do sitting in a chair. Put your hands here first. So breathe out. Breathe in. Raise your hands all the way high up to the back. Hand raising pose. Breathing out. Hand touching your feet. Slowly put your hand down on the ground. And slowly bring your head close to your. Then first is your horse riding pose, Asta Sanchalanasana. Bring your hands high up, hold your knees, bring it close to you and spread your leg high up. Open your chest and look high up. Breathe in. Breathe out. Bring your feet in front and bring your head towards your knee. This is called your mountain pose, Parvatasana. Slowly get into the floor. It's called Ashtanga Namaskar, like a touching 8 limbs. Slowly put your feet together and bring your hands close to your ground and bring your head in the front as if you are in the ground. This is your breathing in. Breathing out, get into a cobra pose. Get into the hand into the back. Slowly open your chest. Look high up, breathing out. And go back into your mountain pose on the opposite side. It will be your breathing in. Breathe in, feet comes high up, head comes down, touching your knee. Breathing out, horse riding pose again. You try to bring your knee in front, your foot goes in front, chest opens up, look high up. Breathing out. Breathing in, go back to your hand touching your feet, Padahastasana, hands on both sides, feet, hands on the ground, head towards your knee. Then breathing out, hand goes all the way to the back, hand raising pose, and breathing in, hand comes in the front. 12 steps, and you started with the breathing in, ended with breathing out. We always do it in pair with the opposite breathing. Let's try with opposite breathing. This time we'll do it without mentioning the names and very silently and very closely. This time we'll be doing breathing in. Breathe out first, breathing in. Breathe out. Breathing in. Breathing out. Breathing in. Breathing out. Breathing in. breathing out. Breathing in, breathing out. Breathing in, breathing out. Wonderful practice in the chair. Let me just show you a few asanas on face down and face high up. You probably know all the asanas. I'll just show you briefly how to do it and then finish our practice. We're not going to do the whole, how to, just to show the technique, how to do that. Like when you're laying down in the ground, that, remember, we're not doing any savasana, not doing any counter poses, because every asana was a very relaxing asana. When you lay down, hope you can see me, yes. Always try to see the chin behind your, below your forehead. Don't be like this. This is very sympathetic. Put it down like this. Keep your feet separated up to width of the mat. Hands on both sides. Palm facing high up. And if you look at a baby, baby does abdominal breathing. Like you put your hand, you'll see with the breathing in, stomach wall will rise high up. Breathing out, stomach will go in. Breathe in, breathe out. It's also very relaxing, and this also creates a parasympathetic activation. It also ignites your digestive fire, which is a parasympathetic activation. The first asana you do, try to raise your feet high up. It's called feet raising, and slowly get your body high up. You get it, you call it boat pose, lokasana. Very important therapeutic asanas. These are therapeutic asanas. Come down, you do a knee chest. Hold on to your knee. You can even hug. Hug your knees. Bring your head high up. Touch your nose to the knee. Chin goes in front of the knee. You are relaxed enough. You can do side to side. You can do wonderful practice. You even can do front and back. All the way to the front, all the way to the back. Do a little bit more. Take your time. But today, just to demonstrate to you how to do them, I'm showing it to you. But when you do more and more practices, we'll do it better way. Spinal twist. It's called Makadasana and a monkey pose. Put your feet together, hands on both sides like a T. Look into your right hand and drop both the knees to the opposite side. And able to stay as if you're breathing as a normal breathing. Bring your high up, look into your left hand, bring both the knees in the opposite side and looking at the other side. Able to stay in the pose within 5 to 10 breaths. It's all the asanas. You can do a lot of different ways. You can separate your feet, going both sides, swing same, or you can do another very powerful way. You can raise both the feet high up, hands on both sides, look into your left hand, take both the feet, comes down and touches your right hand, and look into your left side. Little advanced, same asana, Makadasana. If you're doing it bit right, you will see the difference. Same way, you do the opposite side and turn your head away from you. These are the asanas you do in sequence laying down. It helps your digestive fire. It helps with your truncal obesity. It helps in your reducing this spare time. Bridge pose, hand touching the back of the hill, raise your body high up, as if like a bridge, put your hands underneath, Slowly and slowly you'll be able to raise body all the way high up. When you're pretty relaxed, you can raise 1 foot high up. Setubandha Sarvanga Asana, bridge pose, the balancing bridge pose. When you relax, you can do very easy. You can do shoulder stand, you can do plow, even you can do shoulder stand, and the lotus on the shoulder stand. But these only comes with the relaxation. Let's see if you can do it. You can go all the way to the back. First of all, you can do it. And there is some steps. You can do step by step. But slowly when you relax, you get high up. Slowly you can go down and get into a plow pose. From here, when you relax, you can do a lotus at the shoulder stand. You put it 1 foot here, take the 1 foot here. Wonderful relaxing asana. Lotus on a shoulder stand. Then again, when you come down slowly, you can do this thing, is very nice. Put your knee, drop your feet down, push it, relax yourself. Beautiful laying down asanas. With laying down asanas, you can do a lot of asanas, how to improve your sleep. You can sleep like a baby. What you do is also very good for your back pain. You have a hip relaxation. Put your feet together. Bring it up. Let the knees come down. You will see the baby sleeps like this. Called sleeping closed angle pose, Supta Baddha Konasana. Slowly when you're doing your breathing out longer than breathing in, then you get a little bit of breath holding. Then when you sleep, yogi sleep on the left side, yogi sleeps on your hand, a fetal position. It's a wonderful practice. When you get up, straighten up your leg, slowly get up. You do some back bends on laying down. When you face down, you do the back bends. Those are called treatment for your chronic low back pain. You don't do unsupported back bend. They're called supported back bend. So what you do, see, more and more you relax. This is called your actually Shakti asana, strength. Like you put your face down, hands on the, this is called your Makadasana. You can do one which is called your television viewing pose. This is the way maybe children see television. Makadasana. You can bend your feet into breathing. Breathe in, breathe out. You can do a cobra pose very simply. Put your hand one on the top. Slowly get up. See how far you can get up and stay here. It's not how far, how long. How long you stay? Cobra pose. Same thing when you find the pose, put your hand, go high up and able to stay in the pose. Going a little farther is called your oblique cobra pose. Very good for your proper elimination, proper your health. Separate your feet up to the width of the mat. Slowly get high up as a cobra pose. Then look all the way over the left shoulder towards your right foot. Same way, go down, go in a cobra pose, look over the right shoulder towards the left foot. Tiryak Bhujangasana, oblique cobra pose. With your hands underneath, so locust, put your feet all the way high up, And it's not how high, how long you can stay. Because we are running out of time, so I'm just showing it to you. The bow pose, Dhanurasana, hold your foot and get up into a bow pose. Another one, very powerful relaxing asana, is called a strengthening asana. In yoga, more and more you relax, better and better you strengthen. Face, turning to the left side, feet goes high up, hip at a right angle, knee at a right angle. Let the whole body completely relax, stay here. It's almost like a savasana, a corpse pose. Do the opposite side, on the right side, take the feet all the way high up. Hip at right angle, knee at right angle. Keep it here, slowly go high up. I don't know what happened, something happened. I have a problem. Okay, let me show it to you now. I think finally I can see in my other screen. Let's finish with what is your most relaxing asana. Most relaxing asana is your headstand. Now you don't do a headstand. Headstand comes to you. How the headstand comes to you? First, you sit down in your, it's called Vajrasana. Vajrasana is the most relaxing asanas. From here you find your stance. This is your stance. In your stance, you put your stance in the front, then you clasp your hand and put your hand down. When you put your hand down, then what you do, you put your head down. First, you feel miserable. You cannot talk, cannot breathe, face is all flushed. Slowly and slowly, your breathing normalizes. Breathing normalizes, get up. Don't do anything, just keep walking. If you keep walking, you will see your body is going to go high up. Body is going to go high up. It is going to go high up. You are talking, you are breathing, you are totally effortless. It's a wonderful practice. By the time you come to here, you come down. So what I'm trying to show you, I have done my practice this morning. So you really don't have to go all the way high up. You go in stages. Slowly and slowly go in stages. Only thing you have is fear. If you fear, you can fall down. If you fear falling down, you see, always in a headstand, you always fall down in the front. So when you fall down in the front, what you do this practice, and within a short time, you'll be able to get over with it. The head down, slowly, you just... See, you are in total control. You are not out of control. If you cannot do it, you can go against a wall, do it against a wall, you'll be able to do it very easily. So nice, this is an asana practice for yoga therapy. And we have gone through in the step by step by step, excuse me, that it will take some time. So the initial concept is bring a relaxation response, a grounding pose, eyes closed, hand mudras, breathing effortlessly, breathing out longer than breathing in, and closing your five senses, creating a sound of a bumblebee breathing. Relax your whole upper part of the body, in the back, lower part of the body. Relaxation response. Able to do some grounding poses, like a thunderbolt pose, do your monkey pose, frog pose, rabbit pose, then sit down, do your therapeutic asanas, like your spinal twist, then your cow face, able to sit down in your squatting pose, able to get up without a support, do the balancing pose, standing on one foot with the eyes closed, head below your heart with a spread leg, do a sun salutation, in a standing up or in a chair, face up, all the asanas to massage your abdomen, called abdominal fire, fit raising, boat pose, knee chest, spinal twist, bridge pose, shoulder stand, plow, lotus on a shoulder stand, face down on your called back bends on a mat. First is called crocodile, Markarasana. Then you do your cobra, Bhujangasana, multiple ways of doing cobra, oblique cobra. Then you do the locust. Then you do bow pose. Then you do profound relaxing, called a strengthening Satyasana. And you do a wonderful relaxing asana called a headstand. Wonderful practice today. We'll come back again.
Okay. You're all back again. So you have seen the practice, what we have done. And the practice was primarily for a patient who came in with different medical issues. And you have seen that in stages, and slowly, we took them to any asana you can think about. And then you will see also this afternoon with the pranayama and meditation, we'll be doing the same thing. One very important aspect here is that the asana practice we just saw, it is based on total as a relaxation response. Primarily, the whole yogic concept is yoga for digestion. Yogic concept, you'll see the food is not an energy in yoga. Food is converted into your body tissues, converts into 7 different tissues. It provides a little energy, which is called the body's immunity. And you'll see you will be doing more and more. We'll show it to you, the asanas to improve your digestive fire. And to talk a little bit about what you are going to eat. Now let's first start with a little bit of presentation, which I don't think I sent it to you, which I'm going to send it to all of you. So you will have it as a part of your. Can you see my slides? Say yes, no.
I can
Yes.
see it.
All of you can see? Great. Okay. So let me just go over with you a little bit what is yoga therapy and what is an introduction to yoga therapy. I carry too many hats. That's okay. I teach multiple level and multiple people. I have the highest possible degree in yoga. It's called the Doctor of Letters. This is about PhD. This is an honorary degree. And I also have all the certification from yoga therapy, like called a certified yoga therapist from International Association of Yoga Therapists, National Ayurvedic Medical Association. I'm the faculty member for the first yoga university in the world outside India. This is in California. I was an associate professor. I was a vascular surgeon. I was a past president, American Heart Association, International Association of Yoga Therapists. So it goes on and on. So the most important concept of yoga therapy, what we described the whole morning, is adaptation of the yoga practice based on the client's need. And like a Western medicine, we call it evidence-based medicine. We call it a show me. Give me the number, show me the, the evidence. I need the research papers. But in yoga also, if you go to yoga therapy, as I said, if you look at your called PubMed. PubMed is the one which shows all of your research articles. We'll get almost 12,000 articles. But the most important is called a practice-based evidence. If you practice it, you will see. And many a time I just say that yoga is a 99% practice, 1% theory. Keep on practicing, you will see the evidence of therapy will come to you. And these are the few philosophical words we talk about it. When you practice yoga, what happens? You start developing what is called introspection. Introspection is when you close your eyes, do the yoga and asanas, you can feel the effect of these asanas within your body and mind. Essentially what happens, you don't have any language to describe, but you can feel within yourself. And that's the one we talk about. We call it this is a doctor within us. The doctor within us awakens the doctor. And that's the way you see the whole, that there's no problem in the world which does not have a solution. There's no disease. Awaken the doctors within. That happens with yoga practice. We must make our body to work. And as I told you, yoga therapy says you must make the body work, but you must keep your mind very still, stillness of the mind. And nothing has a greater power but the healed self. Finally, you say, I'm the cause and I'm the cure. This is the information I'm going to share with you, so you will have it. So you will have it for your studies, and we'll be able to share with you. This is an extremely important statement. Even our Western medicine, our father of Western medicine, Hippocrates, long time back, he said, it is important to know what sort of person has a disease than to know what sort of disease a person has. You as a yoga therapist will be the same thing. You'll be trying to take care of the whole patient. This is called a holistic. Holistic means total. In opposed to called reductionist. Reductionist is a Western medicine. I have pneumonia, give me antibiotics. I have diabetes, you give me some medication. But for yours yoga therapy, you have diabetes, you're going to find it out. What is the root cause? And by the time you do the yoga therapy practice, you're going to correct the root cause of the disease. It is not going to be like a Western medicine, which is, we call a reductionist approach. We also say a very nice statement. We call a reductionist holism. Reductionist holism means We know that you need to do a relaxation response. As I said, you must have heard it before as saying, 100 times. It's the activation of relaxation response, activation of parasympathetic tone. And when you do that, the holistic slowly and slowly becomes also reductionist. So you know what to do for what. This is the first yoga university, just got approved in state of California. It's in Los Angeles. They're starting a course, Master in Yoga, in August of 2020. In fact, they have open house today, and I'm going to join them. This is my book. I was talking to you, Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. So I have the two pictures. The cover is designed by my wife. It's called Illustration of Albert Einstein and Tagore. Einstein is a scientist. Tagore is a philosopher who said the yoga therapy is when a science meets a philosophy. That's basically yoga therapy. You can buy the book very easily. My previous publisher, Lulu, sent softcover. Amazon sends a Kindle, sends the hardcover. But this book is, a lot of pages inside. I think most of you have the book by now. It is like a textbook, and it has all the pictures. Everything is in the colored. So they took a lot of the costing for this book. So what I did, I asked the publisher, I said, listen, most of our students needs this book because this book you'll see, this is the guide for you. Like when you go and say, if you whatever you want to teach, if you teach asana, you can go back to the asana, you will have the asanas, how to do it, what are the indications, what are contraindications, what are the effects. If you do pranayama, there's a whole set of pranayama, mudras, anything in it, bandhas, kriyas, everything is there. So it's like a very nice handbook like a thing. So they came back and told me that they can give a lot of reduction in the price, almost 40-50% reduction, but it has to come through me. They cannot do it because if they do it, it became their official pricing. There's a bunch of books in the market. It's my friend who wrote it, Yoga as a Medicine, Meditation as a Medicine. This is the book called Yoga Therapy and Integrated Medicine. I wrote the foreword for the book. This is me writing the foreword. Another person, Dean Ornish. Many of you have heard his name. Dean Ornish was the father of reversal of heart disease with yoga. He's being trained in Yogaville. Yogaville is very close to us, a little south of Charlottesville. Many of you may have visited or like to visit because it's a world-renowned yoga place. We also go there quite often there. Very important place. This is the Principle and Practice of Yoga in Healthcare. This is being written by 4 of my friends, Sadbir Khalsa and me. We do a class together. He's a researcher in the Harvard, Lorenzo Cohen. He comes from Houston, place called MD Anderson Hospital. It's the best cancer hospital who uses yoga as a therapy in their program. Timothy McCall is another physician like me, turned into a yoga therapist. He wrote the book, Yoga as a Medicine. And Shorty Tellis is the #1 yoga researcher in the whole world. She has over 500, I don't say 500, maybe 400, 500 publications. A new book coming up, a research-based perspective on the psychophysiology of yoga. It's a very important book. I just looked at it. This was my first DVD. It's called Taksha Yoga Therapy for Health and Healing. So the 3 DVDs were there. One is asanas, pranayamas, and one was pranayamas, mudras, bandhas. It was very popular. And now I have another one. It's called Yoga Therapy for Health and Healing. This comes, in chapters. And each chapter is how to relax your upper part of the body, lower part of the body. Exactly the practice. I showed it to you. Same practices in my DVD. It's very, very popular, and almost it's like a bit becoming like a text for yoga therapy schools. And another nowadays called a Ayurvedic yoga therapy. Ayurvedic yoga therapy is another certification which we just recently received. This is called a chin lock, and chin lock will show it to you during pranayama practice. It's a wonderful practice. With a lotus pose with a chin lock. This is just a little bit of a like yoga research. This is me. I wrote an article I call Yoga Therapy Today, Understanding Yoga Research. I just want to go over with you a little bit to show you the state of yoga therapy in the United States. As I said, if you look at the US National Library, and the search engine is called your PubMed. If you put a yoga therapy, I just did it 3 days back on July 22nd, over 5,000 article comes up. And it's called National Institute of Health, NIH, almost 449. These are studies being funded. So you know how much interest our modern medical science have, because we are very good in diagnostic procedure. We are very good in acute care. But in the chronic care, we are failing, and failing really badly. Chronic care, like even simply chronic low back pain, simply your diabetes, hypertension, even in the heart disease, we do angioplasty, we do bypass, everything. But what else? But yoga therapy, same when you go to the meditation, which meditation actually is a part of yoga. There is nothing called yoga and meditation, because yoga is meditation, meditation is yoga. Meditation is the seventh limb of yoga. Got over 7,000 articles, 400 funded studies. This is a very important development. Even about almost 7 years back, there's a very famous American journal called Journal of American College of Cardiology. They published an article, Yoga Therapy for Atrial Fibrillation. It is a disorder of the heart. The article is not a very good, well-written article, but this journal does not accept an article that easily. The rejection rate is almost 1 in 10. If you submit 10 articles, 1 will be accepted. When they accepted a publication like that, it gives us some hope that yoga therapy is here to stay. This is called a NCI grant. It's called National Cancer Institute. They gave a $4.5 billion grant to MD Anderson. He's the one who wrote the book, Lorenzo Cohen, and he's doing all the research about yoga therapy for breast cancer. This is another very famous journal called Journal of Clinical Oncology. It's for oncology, means your cancer, yoga therapy for breast cancer. And this is called randomized controlled trial. Randomized controlled trial basically means this is a research which is based on our Western medical concept. I'm showing you this thing just to give you an idea where you are and what you're going to face. But the moment you're going to come out and work as a yoga teacher, you will be bombarded with all the patients coming to you. It's another article showing yoga therapy breast cancer. This is the University of Virginia. University of Virginia has started a foundation in medical yoga for health professionals. And I was one of their advisor to the program. They asked me to be in the program. I just turned it down very politely. And the reason is, at this time, I'm just a teacher. I just teach and I leave. I don't go into any kind of organizational work. This will need a lot of organizational work. In fact, I trained all of the teachers. They invited me. So University of Virginia in Charlottesville, they're having a medical yoga for health professionals. This is another very interesting development. Maybe one of you might be interested. This is called Master of Science in Yoga Therapy. This is in Baltimore, called Maryland University of Integrative Health. They're very well recognized now. There are 2 Master of Science in Yoga. One is here in Baltimore, another one is Los Angeles, called Loyola Marymount University. I was teaching a class here a long time back, and then there was a person who was taking my class. One day I see her daughter came. And we started discussing. Daughter says, yeah, I'm finishing yoga teacher's training. I'm going to be the first batch of the Master of Science in Yoga Therapy in MUIH. She finished. And what interesting is, all of them, they finished. I don't remember exact number, but maybe they have started 30. They finished about 20 plus few people. All of them had a job. And big medical centers are hiring. Cleveland Clinic hired about 10 yoga therapists. The same way as Harvard. Harvard has a yoga therapy program. Every hospital is hiring. Very interesting, you know, there is a very beautiful article where more doctors are prescribing yoga. And what happens when the doctors are prescribing, patients will come to you and you are going to be able to handle it. Yoga therapy becoming a sort of a subspecialty, but you are in the beginning. Yoga therapy for hypertension. I'm showing it to you for one thing, that this is the article which is being published in 1973, long time back, before people even heard the word even the yoga. You know, very important concept. It's in the Lancet. It's the same article. I'm just showing it to you. And this article in 1975 showed that if you have a high blood pressure, hypertension, yoga therapy being a relaxation response for hypertension, able to lower the blood pressure. So by the time you practice relaxing asanas, relaxing a pranayama, relaxing a meditation, this thing is going to happen. This is the person I've been talking to you, named Dean Ornish. Dean Ornish was the first called reversal of heart disease. And he showed by practice of yoga, and yoga is also, remember, yoga is your daily routine. Yoga is your lifestyle. It's called a lifestyle medicine. And same thing happens. The heart disease gets reversed. Even there was a blockage in the artery, and he showed the blockage slowly even opens up with the practice of yoga. This is the area of the heart which did not have much blood supply. And after a practice of yoga, the blood started to flow. And he's the one who has started the program. And many of you might know that we have this program here in town. Is in your Centera, your in Virginia Beach, the new Centera Hospital, and our director, you know, Amanda runs the yoga program in that program in Virginia Beach. Princess Anne, you know, Princess Anne in Virginia Beach is Centera, and Amanda runs it. Thank you, Amanda. Thank you for spreading the yoga therapy for all of us. This is the program they have done called Dean Ornish's Lifestyle Medicine, and the word is called Undo It. And very important program. And maybe one of you will be hired in the program. So you need to learn yoga as a therapy to continue those programs for all the people. This is the National Institute of Health, called NIH. They have a different section called National Center for Complementary and Integrative Health, called NCCIH. They have a whole section of yoga and what the yoga does, how much they're funding for yoga. It's a wonderful section. Remember, National Institute of Health, NIH, is the center which dictates the state of a health care today, including your present day COVID-19 crisis. NIH is helping to find the vaccine. So they're looking at a yoga now. And they've been showing people are practicing yoga pranayama. They have a lot less COVID-19, and they're documenting it more and more. These are the old websites for NIH. There's an organization called International Association of Yoga Therapists, called IAYT, and I've been its president for almost 5 years. And we have developed a standard, accreditation, certification So they've all got certified. The certified is called C-IAYT. Amanda is certified. I'm certified. We have about, I think, 13 or 14 people in Hampton Roads who are certified yoga therapists. We do a program called SITAR, Symposium on Yoga Therapy and Research. Then we do one dedicated called Symposium on Yoga Research program. Amanda being there, you know, few of them, and I met her a lot of times in these conferences. Very important for you also to join these conferences. This used to be an on-site conference, now becoming more and more your online, so you'll be able to join even from home. This was the upcoming, and this year is all going to be online now. We have a journal called International Journal of Yoga Therapy. This is a very called PubMed approved journal, a very well-respected journal. And this is called a YTT, Yoga Therapy Today. This is for practitioners journal. And so let's look at how we look at yoga. What is yoga? As I said, yoga is a union of body, mind, and spirit. And if you look at our Western medical term, our body is a hardware, actually Western computer term, mind is a software, and spirit is a programmer. Who is the programmer? I am the programmer. I am programming my software to fix the hardware. So what the yoga therapy does, yoga therapy fixes your software. So the hardware gets fixed, as simple as it is. More and more you practice yoga, more and more you will see that you are getting into deeper and deeper insight. The outcome of yoga is called a self-realization. Self-realization, I said, is like called a develop your realize. Realize means you start looking backwards. Instead of looking outside, you start looking inside. Finally find out, essentially, that I am the cause and I'm the cure for all the chronic diseases what I have. Very, very important reason. This is a philosophy called Yoga Sutra of Patanjali, 196 sutras in 4 chapters. Practice is called Ashtanga, means 8 limbs of yoga. Yam, social restraint, niyam, personal restraint. Asana is alignment, internal, external. Pranayama is a pranayam. Prana is a life force. Yam is a controlling your life force. Control and restrain your breath. Pratyahara, pratta means reject. Ahara means input, withdrawal, control of your sense organs. Dharan is a holding, control of your mind. Dhyan is a meditation, the 7th limb. Samadhi is the 8th limb, is a balance of body, mind, and spirit. So remember, the whole outcome of the practice of yoga in stages is your meditation. At the level of meditation, we call meditation is the medication. So in a basic yoga therapy practice, what we have done today, you understood it very well, it's a transformation. And it says not to master the posture, but use the posture in stages for transformation. How I start where I can, what I can do today. So non-competitive. What do you look for? Pain. If I get pain, I go too far. And also effortless breathing. I have effortless breathing, I have no pain, and slowly progress. And what happens? This is called your habit forming. When you get a habit forming, this is called your neuroplasticity. Body will allow you to get into those asanas. Flexibility will come to you. I'm not flexible, I cannot do it. Try doing your relaxation response. Flexibility will come to you. This is called a mind-body hygiene. Very simple. I said, what will happen if you don't brush your teeth for a month? Your teeth will all fall off. So if you don't do your mind-body hygiene properly, you are not going to have a proper health. Health comes from your proper mind-body hygiene. Very important. It is a personalized lifestyle changes. Very important is when you start doing yoga therapy, you will see it's almost becoming like an individual practice. You may do in a class. You may do in a class, you said, this you do, and you do it at home. started doing. Somebody will have a different effect, somebody will have another effect. So it has become a very individual, personalized practice. It is synergistic. Synergistic means you can do the practice even if you're on another medication, another treatment. I'm on radiation therapy for breast cancer. I still can do a yoga therapy, but I'm taking a medication for my heart disease. I still can do a yoga therapy. Yoga therapy almost no adverse side effects if you do it properly, listening to your body's signal. People get hurt in yoga when they push themselves too much, when they don't listen to their body's signal. Body's telling you, don't push when you have pain. Body's telling you, don't push when you cannot breathe effortlessly. And it's transformative. What it transforms is a very nice picture. A friend of mine sent it to me. There's a picture of Michelangelo's David. Beautiful, nice picture. It's called After 2 years visit to United States. This thing happened to Michelangelo's David. Then the bottom was that the sponsors were, the Starbucks, Panera Bread, maybe Kentucky Fried Chicken, McDonald's. You don't know who did all, but yoga therapy will transform this David to this. Very, very important. This David has a lot of disease. This is called a truncal obesity. There is no truncal obesity here. Very important. These are some cases I want to show. This is for actually me. I had open heart surgery about almost 20 years back. And with yoga therapy, I'm essentially disease-free, medication-free, enjoying a quality life 20 years down the line. This is a fellow, he comes to my class. I was teaching my class. He had a significant heart disease, inoperable, called coronary arteries. After about a few months, that's what he's doing. He's doing a half locust. He's called a Bakasana, crow pose. And this is a lady, actually, she has multiple sclerosis. She's sitting here, and I know she had a Parkinson's disease. And actually, it's a wonderful outcome of this. She's sitting down. It was 90 degrees in a chair. So he said, I'm doing so well. And he went to see the doctor, and the doctor says the heart function is getting better and better. He calls me, he says, I want to learn a headstand because in a headstand, I know it is a very relaxation. So he started doing a headstand. And miraculous things have happened. His blood chemistry got better. He's off medication. And most of the physicians even could understand what happened. This is a lady. She also had a multiple sclerosis. She was even a wheelchair bound. She had a serious asthma. After starting the yoga therapy practice, within 1 month, she could stop her medication for asthma. With yoga, her leg weakness got improved, the balance improved, her medication for multiple sclerosis got reduced. This man had a Parkinson's disease. He started doing yoga, and there's balancing. Parkinson's cannot do balancing poses. He did balancing poses. He even started doing even a headstand. And he tells me when he does a headstand, the tremor in the hand slowly goes away. Robert, he is called a cardiac cripple. He had so many cardiac episodes. He had open heart surgery in '69, had a malignant hypertension, a surgery for thoracic aneurysm, atrial fibrillation, pacemaker. Most of the cardiologists literally gave him up, So he said, he's just take some medication and see what happens. He started he said these balancing poses, and he does the eyes closed, he does the mudras. So the quieting down his mind and cardiovascular system. He has a profound effect. There's a profound effect. Even his blood chemistry got better. He's a man, he in a place, where I teach, also in a place called a Sattik Space. and he had a cataract surgery. And the doctor who did the cataract surgery, he himself is also a yoga practitioner. And most of the eye doctors says, don't do any, inversion headstand after a cataract surgery. But he'd been doing all of his whole life. So doctor says, just go ahead, keep on doing it. 6 weeks down the line, he's fine. So once you know the individual human being, and this is the way you will learn as a yoga therapy teacher. There's a fellow who is actually a Russian researcher. He said the yogis can sit down outside, snowing with no clothes on. How? They know how to balance. They're called autonomic nervous system. They have control over autonomic nervous system. And here he is doing is called the abdominal lock. With abdominal lock, it's a tremendous, it increases blood supply to the skin so they can be there. There's a friend of mine, he's actually a professor in Eastern Virginia Medical School. He's doing a research using yoga therapy for people with all cardiac condition. The interest which came to in United States was first, this is what in 1969, his name was called Swami Rama, and he has a center now in Poconos. In Poconos, he has a center called Himalayan Institute. And he said with the yoga practice, by closing my eyes, I have a control, I can stop my heart. So here's a cardiologist, and they hook him up, and then he could stop his heart. But at the time, there's a lot of irregular heartbeat, and he could even control blood supply to his hand. So it's a tremendous, the beginning. So they've come up with the conclusion that is a relaxation response. And the fellow, his name is called Dr. Herbert Benson. Herbert Benson is the first one. He's from Harvard University. He studied the people with called transcendental meditation. And during the transcendental meditation, he finds that people's heart rate comes down, blood pressure comes down, oxygen demand goes down. And after all this information, he wrote a book called Relaxation Response. It became New York Times, one of the bestsellers. But one very important thing, what it is, was that the information he had in this book called the Relaxation Response is nothing but the effect of yoga on your body and mind. Primarily, it's a meditation. Very important. And he continued. In fact, he's still there today, even after this almost 50 years. He runs a center called the Herbert Benson. And he just recently wrote a paper, The Effect of Relaxation Response on the Body and Mind. How yoga therapy works, the word is a big name called psychoneuroendocrinology. But the most important thing, what you need to know, that the practice of yoga affects your brain, which is beyond our functional brain. It's called an emotional brain. Emotional brain is called a limbic system. And during emotion, what happens when you are closing your eyes and doing the practice of yoga, and emotion is primary, is a fear, is a memory, and all of them slowly starts to go down. Limbic sense and senses signal area of the brain called hypothalamus. Hypothalamus keeps our body in proper, we call it homeostasis. Means keeps the body in a default mode. What's the default mode? If my blood pressure goes up today, body has the capability to lower it down. When blood sugar goes up, body can do it. That is function through hypothalamus. Then it acts through called your master gland called pituitary gland, which is a master gland, and also through your sympathetic nervous system. So again, what I was telling you during practice, a parasympathetic tone goes high, and parasympathetic is called calm and digest. That is the one we'll talk about more and more, digestion. Digestion is the most important yogic concept. And these are all, I want to give you that. This is called the epigenetics. If you never heard of the word, you might Google it. We all talk about genetics. People get a disease from genetics. But epigenetics means your environment around you creating an effect on your body and mind, creating a disease. And yoga therapy controls this epigenetics. And for the breathing, which you'll do it this afternoon, you'll see the inhalation is sympathetic, exhalation is parasympathetic. So you will learn with the closing your eyes, the one practice we did, breathing out first, then whatever you can breathe in, and we'll do breathing out longer than breathing in. If you can do 2 seconds in, and you'll see longer. If you can do 3 is good, 4 is better. So, but without any effort, without any stress on your body. This is the one concept. This is the basic your chemistry. This is high school chemistry. We call it aerobic. We call it aerobic glycolysis or aerobic respiration. Like our end product of our digestion is called glucose. Glucose combines with oxygen. It forms carbon dioxide, water, and called energy. It's called ATP, called adenosine triphosphate, which gives us the energy. So carbon dioxide comes out from your lung, water goes out through your kidney. But if you don't have enough oxygen, it's called anaerobic glycolysis. The glucose then breaks down into called lactic acid, pyruvic acid, pain-producing substance. It makes us miserable. So if you don't have enough oxygen, you produce the substance in the body, which is very harmful, especially creates a pain. So able to remove that carbon dioxide from the lung, and you will see, we'll do a breathing called your Bastrika bellows. We'll do effortlessly. I do it all the time. You may have a little drainage from your nostril, but that is, we clean it up. But that is the way you improve your whole, the function of your body. You get into in stages, and this is the one I was showing you to during practice. I can sit down to call it easy pose. Put your 1 foot under your knees and sit down. Close your eyes. Use your hand mudra, it's called hand gesture. Do the breathing, breathing out longer than breathing in. Slowly you'll be able to get 1 foot high up. It's called your perfect pose. You get more relaxed, you can put 1 foot high up. It's called your half lotus. Then you can go both the feet high up lotus. You know, people will say, oh my God, looks like, you know, it is hurting you, it is bothering you. No, it is a profound relaxation response. And that is the beginning of yoga as a therapy. Here it is. When you get into the relaxation response, we call it a preventive medicine. We say yoga therapy works, called the primary prevention. Primary prevention, this is called primary prevention. What it is, that my father has a hypertension, my father has a diabetes, I'm going to have a diabetes, I'm going to have hypertension. But if you continue as a yoga therapy, you get a called genetic suppression, prevent onset of the genetic disease. So my father has a diabetes. With a yoga therapy practice, daily practice, I can suppress my diabetic disease. And here it is at a Cleveland clinic. It's in Cleveland. It's a very famous, one of the famous medical centers in this country. They call it their Lifestyle 180 program. Very important. There's a Time magazine, put it down, how not to end up here in the hospital. And that is basically what yoga therapy is. When you practice it, it's a more of a preventive medicine. They do a chair yoga in Cleveland Clinic. There were 10 different yoga classes. This is a meditation practice. This is the labyrinth. They're one of the medical personnel, the first one who have been designed as a chief wellness officer. We all talk about illness, how the illness affects us, but yoga therapy creates a wellness in our body, mind, and spirit. Secondary prevention, I have the genetic predisposition, maybe a genetic predisposition for heart disease, hypertension, diabetes, and I'm doing all my lifestyle. This is called epigenetics. My lifestyle, my environment, I got the disease. When I got the disease, I get a clinical treatment. Say, to give an example, I have a breast cancer. My mother has a breast cancer. Whatever I did, like my mother, I got a breast cancer. Once I got a breast cancer, I got a surgery, radiation, chemotherapy, I'm cured. But what happens 10 years, 15 years down the line, the cancer comes back. Why? Because it is in your gene. It's called oncogene. Genetic predisposition is there. So what you do when there is a disease, heart disease, cancer of the breast, you name it, all the chronic diseases, you have the therapy, you start incorporating yoga therapy because the genetic suppression prevents progression or maybe reversal of the disease. So the breast cancer does not progress, or heart disease doesn't progress. If you have a heart disease, you might know they have angioplasty, they have bypass, and to keep on doing it, keep on coming, keep on doing it. Today, one artery blocked. After 5 years, another artery is blocked. Rehabilitation is very important. And once you incorporate a yoga therapy in a chronic disease, you get a better management of the disease. Most important, less pharmaceutical support and better quality of life. The people on a bunch of medication these days, if you see somebody at their later part of their life, for diabetes, they take 2 pills. For the high blood pressure, they take 3 pills. For the heart disease, they take 4 pills. They end up taking 4, 5, 8 tablets a day. And practice of yoga therapy reduces that pharmaceutical support. There's almost cure being known in some of the cases, and we have, even in this town. Regular practice of yoga said is called a vagal tone. Vagus is a nerve which transmits a parasympathetic tone, modulates autonomic nervous system. It's a parasympathetic activation, and these are a lot of other things happens in your body which will let you know more and more. This is one very important term you might need to know called heart rate variability. Heart rate variability is a measure of your parasympathetic tone. It's called a stiff heart and pliable heart. Even if your heart rate is low, when the heart responds, heart rate goes up and down with your external stimulus. Like say, my eyes are closed, my eyes are open. Also the heart rate changes. All my eyes are open, you scare me, heart rate will go high. Or I see something nice and beautiful, my heart rate will come down. Very, very important, and that happens with the practice of yoga. Beautiful article about heart rate variability. And these are also the terms called baroreceptor, chemoreceptors. These are more and more your studies they do. So, like, how do you know this stuff? As I said, we have this Apple Watch, and you can even record. You can even record a EKG here. You can record a EKG. Here I am. I'm recording my EKG, and it's a beautiful EKG they record. You can have your heart rate, and we record all of this. We record all of this, and we as a physician, we have a lot of interest. I'm doing a 30 seconds EKG strip. It's almost there. It's a beautiful, beautiful EKG. And just to let you know, I'm doing good. Okay. So he's a friend of mine. He's a pulmonologist in Eastern Virginia Medical School, and he had this. It's called an echocardiogram. It's a Doppler. He knows he can measure the heart. So people putting the patient in called inversion, and in the inversion, trying to see what the changes happens in the body. It's a beautiful way, and this is the research going on. His name is Alex Levitov, and he's showing it to you. In fact, he's doing it. He's doing a headstand himself. He's a physician in Eastern Virginia. He's a professor of medicine in Eastern Virginia Medical School. He's in a yoga studio, and these are the yoga teachers. Many of you might have seen them. They're very famous yoga teachers in town. They're checking the blood flow in the neck. They're checking their heart functions in different yoga postures. There's another one to show that somebody who can do a headstand. People say that when you do a headstand, your blood flow in the head goes high up. But the research shows that when you do a headstand properly, completely relax, your blood flowing in your head and blood flowing in the lower part almost become same. And that's the way body allows you. If there's a more blood goes to the head, body not getting enough blood, the body won't be able to stand up, to fall down. So these are different, all the approaches they're doing. This is called ultrasound showing. So we are talking from scientific data. And that is very important. This is scientific data, so we can communicate with the modern scientific physicians group. And these are called the different, called ultrasound. You might heard it's called ultrasound of the blood vessels during a headstand, shoulder stand, and the plow. This is the one showing when the headstand, the pressure in the neck and pressure in the leg looks almost same. And here in this position, actually is showing that there is a gallbladder. And the gallbladder shows in this posture, the gallbladder has a better function. It empties better. So this is also knowing that in the yoga asana poses, it is internal and external and internal alignment. As it aligns your bones and joints in the body, it also aligns your internal organs. Here it shows better blood is flowing through your kidneys. These are all called genetic research is going on, and it shows, the Time magazine, your gene is not your destiny. It's called neuroplasticity. Neuroplasticity means the habit forming. By repeated doing the same asanas, brain gets a signal. And the yoga has come here. When you see somebody sitting in yoga posture in McDonald's fruit and yogurt, very interesting. This is actually Smithsonian, and as you know, Smithsonian is the iconic art center in this country, and Smithsonian has a whole yoga exhibit called The Art of Yoga Therapy, Art of Transformation. I was there. She was the organizer for that. This is my daughter. She's a lawyer, and she's also a certified yoga teacher. And it's a wonderful experience we had. This is a very famous journal called Scientific America, Neuroscience of Meditation, front page article. Here's a Time magazine, one of the magazine that people see. Look at that. This is called Kukutasana, how the mind can deal with the body. Science of meditation, science of happiness. Even if you can see in White House, Easter egg hunt, there's a yoga going on in the lawn of the White House. How much more do you need? You need a yoga pose. Virabhadrasana, warrior pose in front of White House. We have come a long way. It also people uses this term. This is a laptop, IBM laptop. A laptop is very flexible. So they put the name called Yoga 13. It's in the Lenovo brought the IBM. The IBM laptop is called Yoga 13. Now let me finish with you called Origin of Yoga Therapy, where the yoga therapy came from. Actually, if you see, it is all in the babies. The babies do everything yoga. They will get up into a cobra pose, they'll get in a downward facing dog, they'll get into a cat pose. That is a natural pose. In fact, a friend of mine who does an ultrasound of your body, and ultrasound of the body says, when they do ultrasound and the baby is inside mother's womb, he said the baby is on all different yoga positions. And he's so funny, he said, they're so good at yoga. When they come out with a headstand. The head comes out first. So take a look at it. It's a beautiful pictures, and you'll get a kick out of it if you're looking at it. See, normally they stand up in a mountain pose. They get into the tree pose. You don't have to ask that. It's normal. Normal is to sit down a thunderbolt. easy pose. They get up into cobra pose. They get into a locust. Get into a downward facing dog. They get into cat pose. Get a spinal twist. The wide angle seated forward bend. We try to do it. Try to do it naturally. The Paschimottanasana, like a seated forward bend, it is a normal posture. So when the people are having a tremendous anxiety disorder, panic, fear, anxiety, like what we're having today with this COVID-19, we teach them how to get a child's pose, and they do it natural child pose themselves. That's where they sleep. Reclining bound angle pose, Supta Baddha Konasana. And I told you, you should, try this, sleeping this way. Sleep like this. Do a breathing out longer than breathing in. Do a little bit of breath holding. You will fall asleep right away. It may not happen 1 day, 2 days, 3 days, but it will happen. It's a treatment of insomnia. It's called a boat pose. It's natural. And this is the final message for you to take home. This is actually from Yogaville. The person who started, his name is Swami Satchitanand. He was invited in University of Virginia to give a talk on yoga therapy. He wrote it down illness, wrote it down wellness, then he circulated one I and a we. He said illness starts with I, wellness starts with I, or a we. That's the end of my talk. When I became we became all well. So this is a very important presentation for all of you, and I will share with you this thing. And sorry, here it is. I share with you this, and if you have any question, you can ask me, or you can put it down in the chat. I have, sometimes I can read those chats, or if you want to ask me as a, you can get into a gallery mode. You can ask me. I'll be glad to do it. In the meantime, you are going to take a break. This is going to be a lunch break. During lunch, you are going to go ahead and eat. Eat very light, don't eat too much, light, and do a called intuitive eating. Intuitive eating means pay attention to what you're eating. The food has a quality. Food has a quality, and we have a body type. You will be also having some lecture on Ayurveda. Ayurveda is called Ayu means longevity. Veda is a knowledge. Ayurveda will show you we have 3 body types called Vata, Pitta, and Kapha. The food are also called Vata, Pitta, and Kapha. We have the state of mind. It's called activity of the mind. It's called the very purity of the mind. It is called your dullness of the mind. When the food gets digested, what happens to your body? What are the signs you look for when the food gets digested? So what I will do after you finish eating, I want to give you a little time, because the reason for the time is we like the food to get a little digested. And the digestion in yoga is a little different than the concept of digestion in Western medicine. We'll give you some time for a digestion. We'll talk about digestion. Then we'll present a session on pranayama for different diseases, and meditation for different diseases, and we'll talk a little bit of your body type called Vata, Pitta, and Kapha. If you have never heard of it, maybe in this time you take a look at it. Best place to look. It's called my guru these days. It's called a Google. But when you Google it, always be sure that you look at a reliable website. Google itself has all the yoga information now. Before, Google used to take you to somewhere, and Google has all the information. And if you don't have any questions, I don't see anything in the chat or anything. It's almost 1 o'clock. Let's take a break, have your lunch, pay attention what you're eating. We'll ask few of you what you ate, and then we'll discuss about yogic digestion before I proceed to the next chapter, because yogic digestion is the most important concept of yoga therapy. Okay, let me stop the recording. Now, first of all, who wants to volunteer what you had for your lunch? Then you can go over with a little bit of yogic concept of digestion, and I'll tell you why it is so important from the yoga therapy standpoint. Any volunteer? Or you want me to, you all had a lunch?
I'll volunteer.
Yeah, so.
I had rice, roasted vegetables, and beef.
Just a moment, you are having some echo. I don't hear you.
You can't hear me?
Who is this talking?
This is Jamie.
Jamie, okay. Something is happening to your audio. Can you talk now? Let's see.
Can you hear me now?
Yes, we hear you better. Do you have another? Do you have another microphone? Do you have two cell phones open? Laptop and a cell phone, or no?
No, just a laptop.
That's a laptop. Okay. Sometimes when you have a two microphone, it interferes. Okay. So, Jamie, go ahead and share with us what did you eat?
So I had rice, roasted vegetables, and beef.
You still don't hear good, you know?
Okay,
Somehow.
I'll try to set up my Bluetooth headset. But I'll put myself on mute for now.
Do you have a headphone? Can you use a headphone?
Yes, I'll try that.
Yeah, try a headphone. Sometimes that helps. And other thing is that if everybody is mute, you can put a speaker view. Let me see. Look at a speaker view. The person who is talking will see. Let's see what happens in speaker view. Jamie, are you talking now? Oh, no, you are still mute. Everybody's mute. Can you hear me?
Yeah, we can hear you.
All right.
So this is Tiffany. I ended up just having hash browns with cheese and eggs.
Hash brown with cheese and eggs.
Yeah, I'm kind of on lockdown right now because I came in contact with somebody with corona, so I'm kind of just cleaning out my fridge at this point till I can get somebody to go food shopping for me.
That's good. That's good. That's okay.
Yeah.
But now, if you look at, as I said, we'll talk about little yogic concept of. Let's see if I can see me. Okay. If we talk about little yogic concept of digestion, food and digestion, why it is so important is that in yoga, and also remember there is another, we call it a sister science, we call it the Ayurveda, but Ayurveda and go ahead and just 1 second, let me put it here, we get a full screen. I can see me better. Here it is. Looks good. Okay, so in yoga and Ayurveda, Ayurveda is another sister science, but both have the same roots, same origin. I talk about when you eat, the food needs to be digested. When the food gets digested, and that digestion concept is a little different. And the concept I still explained to you during the morning session was in Western medical term, it's called parasympathetic activation. parasympathetic is called calm and digest. Food is not a calorie, not an energy in yogic concept. Food, when you eat, when it gets properly digested, when yoga says it gets digested properly with the 5 senses. That means what you see, it helps in digestion. What you hear, it helps in digestion. How you smell, it helps in digestion. How you taste, it helps in digestion. And if you touch the food, it helps in digestion. So to digest with the 5 senses, the food first converts into body's different tissues. And the way to talk about the tissues are called 7 different tissues in our body. First, it says that when food gets digested, it first digested into called a plasma. There's a lot of Sanskrit name. I may skip them, or I say called Rashadhatu is a plasma. And slowly the plasma converts into your red blood cell, your blood. It's called Raktodhatu. Then it forms your muscle tissue. Then it forms your fatty tissue. Then forms your bones and joints. Then form your nervous tissue. Then your reproductive tissue. Then it forms a substance which is called the ojas, O-J-A-S. Ojas is your body's immunity and immune system. So what the yogic concept is, the immunity to fight against a chronic disease or even acute disease, even like today with the COVID-19, immunity comes from within. Immunity doesn't come from outside. We're always trying to say, yeah, go ahead, take a vitamin C, it'll help your immunity. Take zinc, it'll help your immunity. Take this thing, that thing. But yoga and Ayurveda says that it's your food properly digested gives you immunity. Why it needs to be different tissues? Because in a normal time, our tissues are being replaced. So for example, I have a liver. Liver cells are first, cells are growing, cells are maintaining the function, cells are dying. It's called a controlled death. Medical term is called apoptosis, and the new cells are formed. But I don't eat liver to make my liver cells. I don't eat kidney to make my kidney cells. I don't eat a heart to make my heart cell. I've been eating this, the things we ate. Even it could be a egg sandwich, could be a little piece of bread, could be a little fish, could be your veggies. But the food gets properly digested, it forms different tissues that forms your body's immune system. There are 3 terms you might like to note it down. One is called a prana. As you know, prana is called a subtle energy, which you cannot measure. Breath is the carrier of the prana. Prana keeps us awake, alive, and functioning. One is called a tejas, T-E-J-S, tejas. Tejas is our inner fire, our inner glow. What does it mean that we have a digestive fire? Our stomach, when you put the food in the stomach, your stomach has a stove top. It needs to cook that food. The food is not properly cooked. So it said that don't stop that inner fire, that stove top. Don't drink a ice cold water before your main meal. Don't even drink a lot of water with your main meal. The reason is you have the enzymes. You have the enzymes. Enzymes needs to work. And if you drink a lot of water, enzymes will be diluted, and it's not going to have any effect on the digestion of your food. So what happens that when food is properly digested, and it says that when you eat food, you should eat with your mind in it. The food is given, the food is part of your body, it will help your body. It's almost like meditating. It's called intuitive eating. What is the intuitive eating is, primarily is that your body knows what you are eating. What does it mean? It means that there is some body signal telling you the food became properly digested, became part of your body. I'll give you some work to do, and you will do it yourself, and you will see how effective it is. First of all, the food you ate, either breakfast, lunch, or dinner, and yoga says the lunch has to be the main meal, because this is the time of the day where the sunshine, this is also called a pitta time, and this is the time the food gets properly digested. Dinner has to be very small and very light, and there is a daily routine in yogic lifestyle. Yoga is called a lifestyle medicine. First of all, if the food is properly digested, you feel lightness in your body and mind. The moment you have some food and you feel like it's heavy, and the moment you feel like you're having a food coma, that food is not properly digested and the food was not part of your body. Lightness in the body and mind. Appropriate hunger and thirst. Appropriate hunger and thirst means when you have a main meal, it takes about 4 to 6 hours before you're ready for another next main meal. Somebody says, I'm hungry after eating my main meal. That means that food was not properly digested for your body and mind. If you've been thirsty all the time, that also the food is not properly digested. Another thing happens sometimes, and most of the time, your brain cannot distinguish between hunger and thirst. So many a time it said, I'm very hungry, okay, have some food. To test yourself before eating any food, drink some water. Now, drink some water if that hunger is gone, that hunger was due to your thirst, not due to your hunger. So lightness in the body and mind, appropriate hunger and thirst, no smell in your excreta. What does it mean? Our excreta primarily is our stool, our urine, and our perspiration. We say all the body's toxin comes out through our proper elimination. When the food is not properly digested, it produces a toxin. And the toxin in the Sanskrit name is called ama, A-M-A, ama. And ama creates a smell in your excreta. So if your stool has a smell, That means that food was not properly digested. If your urine has a smell, it's not being properly digested. If your perspiration has a smell, the food was not properly digested. If you have any belch, if the air comes out from your stomach, most of the belch will have no smell, and the stomach, proper digestion, the stomach will look very slim, trim, not bloated. You feel the bloating, you feel heaviness in your stomach, the food is not properly digested. So able to listen to your body's signal, you will know, is that food appropriate for you? Next, what happens when you do a daily routine, daily practice of yoga, your digestive power gets better and better and better, and you'll be able to digest most of the foods which you won't be able to digest before. We have seen people with the gluten sensitivity, celiac disease, food allergies. Most of them goes away after a proper daily practice of yoga. It's called a daily routine. Again, there is a Sanskrit name. It's called a dinacharya. Dinacharya means your daily routine. And what is a daily routine for a yogi? Daily routine is when the yogi gets up in the morning. Generally, they get up between 4 to 6 in the morning. That is called yogic time. A nice, good environment, fresh air outside. It's a beautiful time to get up. When they get up, generally they try to sit down in a squatting pose. I've shown it to you when you're doing the practice in squatting pose. If you cannot initially, but slow and slow with the practice, you'll be able to. And as you all know, that wherever you started, and look at where you are now, you have transformed yourself. So you'll be able to transform yourself also. So you'll sit down in a squatting pose, then you will have a glass of water. Generally, the glass of water, yogis keeps it on your nightstand for overnight. Generally, they keep them in a copper vessels. In a copper vessels, they will keep it. And then when they drink the copper glass, they drink the water, they'll water in a gulp. They'll close their eyes, they'll take the water and one gulp, 2 gulp. So they do it in a gulp. What the gulp does, the gulp starts the peristalsis of your gastrointestinal tract. That means it starts the contraction. When the water comes into your stomach, when the stomach stretches, there's a reflex called a gastrocolic reflex. What it means that if your stomach stretches, your colon contracts. When colon contracts, you have a proper elimination. That means you have a good elimination in the morning, you have a first proper bowel movement, and all the stool you are carrying in your colon gets eliminated first thing in the morning. And yogic tradition, whenever you are carrying that stool in your colon throughout the rest of the day, that is one of the root cause of the diseases. Constipation is regarded as one of the root cause of the diseases. After proper bowel movement, you brush your teeth, and the yogis do, they take the finger, they put it in a little bit of a oil, and they massage the gums. So they take the hands, they massage the gums, both of them. It's a very excellent practice. If you guys want to start doing it, you will see all the problems in your teeth, that I have a little bit of aches and pains in my teeth, I have some, they all will go away. It really massages the root of the teeth. Again, yoga says if you massage an organ, the organ gets better, organ gets more functional. So try to massage your gum. The yogis will do a tongue scraping. They have a tongue scraper, they'll slowly scrape the tongue. So tongue has a coating, and yogic philosophy says that coating of the tongue is a sign of improper digestion. And the coating prevents you having a proper taste of the food. When you put a food in the mouth, body doesn't know whether it's a protein, fat, or carbohydrate. Body only knows that it is a taste. In West, we have 4 tastes: bitter, sweet, sour, salty. In yogic and Ayurvedic tradition, we have another 2 tastes. One is called astringent. Astringent is a puckering, like you put something in your mouth, it feels like your mouth is puckering, like you put a strawberry or a tannin. There is one Ayurvedic fruit, it's called amla, A-M-L-A, amla. You put the amla, you know exactly what astringent feels like, tastes like. And it's called a pungent. Pungent is with the heat, the hot, the chili pepper. When you put a chili in your mouth, you know you are perspiring in your head. And all the taste creates some physiological changes in our body. So you do the tongue scraping, you put the food in the mouth. In the tongue, when the food is there, it senses the taste and it starts the digestive process. So digestive process is not going on all the time. It's only going on when the body finds that taste in your mouth. So it's very important, the tongue scraping. Then they'll do called a jal neti. It's called a neti pot. They have this pot, neti pot. I don't know if you have seen it. It's a very common now, find everywhere. Even you can find it even in Walmart now. It used to be of a specialized store. It's like a little spout. You put a little lukewarm water and you put a little salt. Try to put a non-iodized salt. You put it through one nostril. Then you close your eyes, turn your head slowly, start breathing through your mouth. And you'll see the water comes out to the other nostril. So whole water comes out, then you blow your nostril and you look at this. Your private practice. See, all this thing, your dirt inside your nostril is going to come out. And the reason is, in the morning after brushing, you're washing your eyes, washing your face, washing your hair. Why not the nostril where you are taking? The most important is your breath. Same thing. You take another lukewarm water. Put about 3 or 4 pinches of salt, put the other nostril, close your eyes, breathe through your mouth, and the water will come out. Initially, it may not come out on the first day or second day because it's a very relaxation response. To close your eyes, it is almost like a meditative practice. I do all in closing my eyes. Closing my eyes when I'm doing it, slowly and slowly, the swelling, the mucosa inside the nose. It's more like almost like erectile tissue. When you get excited, it swells. So when it is cooling down, it comes down. You might see I have a lot of yoga, a lot of videos on my YouTube. You can go to my YouTube channel. If you have my name, Dilip, Sarkar Yoga. One of them is called daily routine. In the daily routine, around 35, 40 minutes in that section, you'll see I'm demonstrating how to do your neti pot. After neti pot, you blow your nostril. Some of the air may be within your sinuses. You do a very gentle pranayama called Kapalbhati pranayama. Hit your stomach, air comes out. You do different posture, your head down, head up, head on one side, head on the other side. Then you hit a little bit on the forehead because there is a one sinus called a frontal sinus. Sometimes water stays here and you hit a few times, all the water comes out. Then you do daily yoga practice, about an hour a day, 25 minutes of asanas, the posture, 25 minutes of pranayama, 10 minutes of meditation. We do what is called a therapeutic meditation. We'll show it to you. It's called chakra balancing meditation. We'll practice today. That is called therapeutic meditation, balancing all the systems of the body to get rid of all the chronic diseases. After the morning practice, then you have a breakfast. And in yogic tradition, breakfast is very small. Because in the breakfast is a time, they have a time divided into the whole day. It's called the body type, called Vata, Pitta, and Kapha. You might like to see what is your body type. Vata is a body type who has the attributes of air. Say our universe is made of 5 elements: space, air, fire, water, earth. And we have also the 5 elements in our body. Space and air creates a mind-body type, which is called Vata. Fire and water creates a body type, which is called a Pitta. And water and earth creates a body type called Kapha. So the Vata has a quality of your air that is very light, very dry, very mobile. You will see some person continuously talking, continuously moving. They never stop one side. The mind-wise, they're continuously, mind is mobile. They're doing 10 different things at the same time. They've never been focused. They need more focus. Another person is called Pitta. They're very hot. They're angry. They're controlling, like a king. I'm everybody. Who are you? The quality of fire. Very organized. If you go to Pitta house, everything will be in order. Everything will be color-coded. If you tell them to do a posture, if you tell them to do close your eyes and do say, tree pose, they'll be a perfect tree pose, because they're very focused. So, and yogic tradition, you always do yoga therapy, you do the completely opposite, the law of opposite. Kapha, on the other hand, are totally grounded. They have a quality of a earth. They like to be grounded. They don't move. They don't walk around. So in yoga practice, you do law of opposite. When the person, if you find the other person is a Vata, you do the grounding poses. Person is a Pitta, which is hot, you do the cooling practice, cooling poses. Like if it's a sun salutation, there's a lot of hitting poses. You take them out, it's called a moon salutation. You do moon salutation for your Pitta people. You do a pranayama, called a cooling pranayama, Sitali pranayama. You do breathing through your tongue. Stick your tongue out, roll, breathe out through your nostril. So where the kapha is grounding, so you need the kapha to get up and do the uplifting poses. They will do a tree pose, they will do a mountain pose, they will do all uplifting poses. And people with the Vata will do the grounding poses. Very, very important concept from yoga therapy. So now, when you had a proper digestion, so you know what is intuitive eating, so you manage yourself throughout the whole day. So during kapha time, the digestive fire is very low. Pitta time, digestive fire is very strong. And in vata time, digestive fire is very erratic. So in a 12 hours period, in the morning, 6 to 10 is a kapha time. In that time, your digestive fire is very poor. So yoga recommends that you have a very small breakfast. Between 10 to 2 is a pitta time, which is a very strong digestive fire, and that is the main meal. So lunch is the main meal. So if you really want to have a little bit of a heavier breakfast, because as you push yourself around, maybe 9 o'clock, maybe 9:30, a heavy breakfast. Don't have a very heavy breakfast, 6 in the morning, 7 in the morning. That food is not going to be properly digested. Main meal will be your lunchtime between 10 to 2. And the food the yoga recommends is that you eat with all the 6 tastes. 6 tastes in your food. Create a food with all the 6 tastes. The food will be properly digested, and use 7 coloring fruits and vegetables. What is 7 coloring? 7 coloring of your rainbow. When you look at the rainbow, it's called your violet, indigo, blue, green, yellow, orange, red. And it's called a rainbow food. You'll see a lot of health and wellness people are recommending the rainbow food. Don't eat only green, don't eat only red. If you take all the multicolor rainbow fruits and vegetables, you don't need any trace elements. I've been hearing so much, oh, the zinc. Zinc is very good to increase your immunity. Oh, kiwi has a lot of zinc. Guava has a lot of zinc. You cannot find a kiwi and guava because everybody is eating them. No, if you take all the 7 coloring fruits and vegetables, all the trace elements in your body, you get all the trace elements, you get a proper digestion. So have a main meal around lunchtime between 10 to 2, food with all the 6 tastes, 7 coloring fruits and vegetables. And yoga says that don't eat any fruit with your main meal. The fruit has a special enzyme which interferes with the absorption of trace elements. The big name is called your intestinal glycoprotein. And it also has another enzyme which interferes with the metabolism of your main substance in your body. It's called a cytochrome P450. Very important. Now, if you're asked to eat fruit with your main meal, what you will do, you'll eat the fruit first. If you don't know how to eat your main meal, you eat your meal from light to heavy. When you have a light to heavy, you have no problem. But yoga says that you have to do with the different tastes, but that is going into further details. Yoga and Ayurveda says you eat the fruit as a snack during your afternoon, as afternoon snacks. So eat as afternoon snacks as a fruits of 7 coloring fruits. I make a point, I buy the 7 coloring fruits, may not be in one day, all different days, and I eat a fruit as a snack in the afternoon. And most of the nicer grocery store now these days keeps a multicoloring variety of fruits. Here, the nice place is your Whole Food. If you go to Whole Food, the fruits are unbelievably fresh fruit. We go there just to get a fresh fruits. Dinner time is a little early. Dinner time is about, we said, 2 to 3, sometimes 4 hours before going to bed. So if your bedtime is around 10 o'clock, 10 to 10:30, so try to have a dinner by between 6 to 7. Dinner will be the smaller because, dinner time, again, that your cycle of the Vata, Pitta, and Kapha comes. Afternoon 2 to 6 is called, and again, the Vata time. Vata time, the digestive fire is very erratic, so it doesn't get properly digested. And in the evening, 6 to 10, again, is called a Kapha time, which your digestive fire is low, so your dinner is smaller, maybe even half of your lunch. Very hard to do sometimes when you're working, but somebody says, I don't feel good, I have a little chronic fatigue, I'm just having a lot of chronic disease on me. Basically, just able to shift your main meal to the lunch and incorporating a relaxation response for your yoga practice is good enough, is extremely good enough. You have no idea how it will affect your body and mind. And we recommend to all of them. Generally, we don't drink too much water with our main meal. We may drink a little bit to help the food to go down, but we generally drink a glass of water, maybe about an hour after our main meal. So again, when you drink a water, I just have a glass of water, you sit down, close your eyes, take the water, and again, you drink in a little bit of a gulp like this. The reason I'm showing it to you, it's a tremendous effect in your body and mind. In fact, in yoga says you should be always sitting down when you drink your water. When you're standing up and drink your water, that water has a lot of other effects in your body and mind. Before going to bed, you drink another glass of water, and then you go to bed by 10, 10:30. We sleep. When you sleep first, you put both the feet together, sleep like a baby. Do your breathing out longer than breathing in with the eyes closed. Slowly and slowly incorporate a little bit of breath holding. Then slowly turn your one side and the right side. Bend your knees like you're in a fetal position. And yogis sleep. Sometimes yogis have no pillows. They put their head under your hand. But if you're put a little pillow, they put a hand down. Within a short time, you'll fall asleep. Insomnia and sleep apnea is a root cause of a lot of our disease today. Water is very important. You are drinking a glass of water after main meal. And then also you are drinking the water when you're thirsty. When you have an adequate water intake, you will know, you will have a wetness of your lips and tongue. You don't need to put all this, the chip, all the oils, put in the Vaseline. You will feel the naturally, you will feel the moist in your body and mind, especially tongue and the lips. Look at the urine. Urine have no concentration. Urine is very clear. And if you maintain a proper fluid balance, you sleep better. Dehydration causes is called hyperosmolar dehydration, and it's an effect in your brain. Sleep is very, very important in yogic tradition. Sleep also have a very light sleep and a deeper sleep. Two kinds of sleep. It's called REM, rapid eye movement, non-REM sleep. But yoga says that you have to have a non-REM deep sleep called stage 1, stage 2, stage 3, stage 4. When you're doing yoga and meditation, and most of the time, throughout the whole day, you are in a stage 1 and stage 2 of the sleep, even if your eyes are open, even if your eyes are closed. So when you go to bed, you very quickly go to stage 3 and stage 4. So it's not that you get a 6 hours of sleep, 8 hours of sleep, or a 10 hours of sleep. How much you get a deep sleep, that is more important. So this is the roughly a daily routine. Yoga is regarded as your lifestyle medicine, and it's absolutely important for all of you to get into this yogic lifestyle. Is it possible today? May not be possible today. Possible tomorrow? Definitely possible. You make an attempt, and then what happens if you do a daily practice of yoga? Slowly and slowly it will come to you. How does it come to you? So think about this way. Today I'm trying to touch my toe, or today I'm trying to touch my back of my left shoulder. I cannot. But slowly and slowly with the practice, closing my eyes, with my twist, I can touch it. The moment I could touch it, my mind says, you know what? I could never touch it before. Something is happening to me. Let me see what I'm eating. Let me see what is my elimination. Let me see how good I'm sleeping. Strong digestion, easy elimination, good night's sleep is a sign of health in yoga. As simple as it is.
I have a question.
Sure, go ahead.
I typed it in the chat. I'm not sure if you saw it. So what do you suggest for people who aren't working like a normal shift? So every couple months my shift switches. So I'll be working night shifts. So like during like optimal digestion time, I'm sleeping. Does it just reverse then for me? Or
yeah, so what happens that people, they always, I get this question all the time. I'm in the night shift for 2 weeks. I'm in the daytime. 7. It's the same phenomena. You are reversing it. But if you work at the night shift, you try to have a little sleep in the daytime. See, this is the issue we talk about. This person comes to me, I work in the night shift, I come home, I cannot sleep, I cannot sleep in the daytime. And this is I've been having the issue. But if you're working in the night shift, so think about that instead of a daytime, you're in the nighttime. But then the daytime, you are going to use it as much as possible as your nighttime. You may not have to sleep that long, but you'll be using that time. So come back to, say, come home around, if you're in a whole night shift, we come home around 5, 6, 7 in the morning. So think about now, this is the time you're reversing your clock now. But you maintain the same daily routine as is the daytime and the nighttime. Body, remember one thing, our body is very used to, called the circadian rhythm. Body is also used to in different time zones. So give you an example. Why the sleep is very important. Sleep and food are both very important. Suppose you're traveling. I travel, before this time, I've been traveling all the time. I'm traveling all over the world. I've been invited from Japan, from the China. I give a talk in Argentina, in Brazil. I've been invited in India. And think about it, you say, 12 hours time difference. So what you get, you develop a called a jet lag. So here I am. I'm going to Japan as a guest speaker. I'm landing in Tokyo. My host comes and picks me up, takes me to a conference. The 2 hours, I need to give a talk, 2 hours talk. And I'm in a jet lag. I fall asleep. I cannot even talk. So what I do, exactly what the question you are asking to me. Before I go to Tokyo, I'm flying from Atlanta to Tokyo, 12 hours flight. When I get into the plane, I sleep and eat on destination time. What does it mean? If I am on the plane at 10 o'clock at night, Atlanta time, it's going to be your 10 o'clock in the morning in Tokyo time. So I don't sleep. I stay up because I'm in a daytime in my destination time. They will bring a dinner for you when you get on the plane because you're leaving around 10 o'clock because that is your dinner time here. So what do? You don't eat the dinner, you hold on to the dinner maybe for a little shorter time, then eat that food as a lunchtime in the Tokyo time. That will be your main meal, lunchtime. Still, you don't go to sleep. When the time comes in the afternoon, you might go have a little snacks, like afternoon snacks. And when the time will come in the evening, which will be a daytime in Atlanta, you will try to go to bed because that is your. Now you are arriving there, say, or I can do other way around, that arriving there in the daytime. What happens if you don't sleep well enough for one night, you are still functional on the next day. But the moment you have a jet lag, I don't know how many of you have a jet lag, you will be non-functional for 2, 3, maybe 4 days before you can function properly. So we have no problem traveling, changing the time from the day to night. And so for you, you will function as the same way, reversing the cycle when you're working. Thank you for asking. It's a wonderful question. Anybody has any other? Does it answer you, or you have another few more questions within you?
No, that makes complete sense, and it seems totally obvious. I just don't know why I didn't think of that.
You know, it's obvious. Plus, we're telling from our experience. I'm going to India. Okay. Another thing I can do when I have the pre-plan. Pre-plan is that I'm going to land, and within 2 hours, I'm going to give a talk. So since I know my timing, when is your flight, what I will do 2 or 3 days before, I will start to sleep a little later. What does it mean? 3 days before my flight, if I'm going to bed at 10 o'clock, First day I'll go to bed at maybe around 11 or maybe even 12. Next day I maybe stay up until 1 o'clock. Third day maybe until 2 o'clock in the morning before I get into the plane. I get into the plane, I eat and sleep my destination time. And since we have been doing for so long and we've been talking, guess what? The Australian Airlines called Qantas. Qantas has the longest flight in the world. I think it's from Sydney to London. I think it's about 18 hours flight. Same thing as Singapore Airlines had a flight from New York to Singapore, 17 or 18 hours. They started doing exactly what I'm saying. They started doing your sleeping time and meal time as a destination time. And sleeping time is, I don't know if you've been to a long, airlines flight, the new planes have the automatic lighting. Fascinating. At nighttime, it looks like there's a star, looks like you are under a, moonlit sky. And daytime, and slowly, and when they come, slowly the daylight comes up inside the plane cabin, and they exactly do opposite. So now you got the idea, you do it, and it is so obvious. Anybody has any other question? I didn't see any of your faces, and I don't know how you guys even look like. What's wrong, you guys? I'm showing some faces. You're all, hope you're practicing what we'll be doing. When you do this on-site for the whole day, we get so interactive. I don't know when we'll see each other again. Anybody has any guess when this crisis is going to be over? Oh my, I have a friend, he said to call it God only knows, Who
Yeah, I was
else
going to
will
say
know?
not in the near future.
Not near future. Not in 2020, huh?
More than likely
2020.
not. It's not looking like it.
Somebody even told me maybe 2022, before we can get together. Okay, let's do one thing. Take a few minutes break, just a stretch break. And it's a very nice stretch break. When you just nice stretch break, you can do all the body. Our body is like fluid, so relaxed and so flexible. What you do, you can sit down in the ground and get up. I think I've shown it to you if you've been in my class, that you can do unsupported, called a sit rise test. It is a wonderful. So what will happen to you? Like you'll be able to sit down. Sorry, you'll be able to sit down comfortably. There's a squatting pose if you can, and slowly get up without a support. It's a wonderful stretch break. Okay, now let me go ahead and put a little pause. Again, recording a little bit. The first will be a pranayama, and you have a little bit of yoga anatomy. Yoga anatomy will talk about the 7 chakras. The chakras are a spiritual center. It is an energy center, which is located along the line of your spine. Chakra balancing is a very important therapeutic meditation. It's called chakra balancing meditation. What does it mean? When the yogis close their eyes, they have seen some color. And the color they have seen, they have assigned the color according to the color of the rainbow. And they assigned the color along the line of the spine, and they had a channel called the nadis. When the nadis intersect, those intersecting points, they're called the chakras, or chakras basically means wheel. So the violet is in the head, is called a crown chakra. It is connected to your nervous system. It also connects with lot of other endocrine system, your nervous plexuses. So for example, this is your crown chakra, violet in color, connects to nervous system. It is connected to a gland called a pineal gland, endocrine gland. And it is also connected through your brain called cerebral cortex. Indigo is in the third eye between eyebrows. This is called your sixth chakra called Agga chakra, A-J-N-A, Agga chakra. It has two wheels, and this one has 1,000 petals. So the two petals is connected through your endocrine system. Any imbalance in the endocrine system, you will be able to meditate on this chakra. It is connected through your endocrine system and also to your pituitary gland. That is your endocrine gland, and also connected through your, we call it your parasympathetic nerve called the vagus nerve, vagal tone. Blue is at the level of your throat, called the throat chakra. It is connected through your respiratory system, and the function is the communication. Color is blue. It is 16 petals. If you look at this chakra, the 16 petals. It is also connected through your thyroid and parathyroid gland, and also connected through your called pharyngeal plexus, that is the nerve. So they're all connected through a nervous system, endocrine system, and the whole body system. Violet, indigo, blue. Green is a level of your heart. It's called a heart chakra. And it is connected to your cardiovascular system. So any disorder you have a cardiovascular system, you meditate on this chakra. It is also connected to endocrine gland called a thymus, and also connected to called a cardiac plexus. The green, yellow is at the level of your belly button. It's called a solar plexus chakra, connected through gastrointestinal system. It is connected through your pancreas, the endocrine pancreas, and nervous system is the solar plexus. So any problem in your gastrointestinal system, you'll meditate on this chakra. Between the belly button and the root of the spine, that is called your pelvic chakra, or Svadhisthana chakra. Color is orange. And it has 6 petals. Or the one in the green in the heart has 12 petals. The one in the belly button has 10 petals. And this one has 6 petals. Connected to reproductive system. Endocrine connected to the gonads, testicles and ovaries. And you're connected to the pelvic plexus. At the root of the spine, the color is red. It has 4 petals connected to musculoskeletal system, bones, joints. Also connected to your adrenal gland. Adrenal gland is a power. It has a power. And is connected through called a sacral plexus. But these are in imbalance. They can be balanced with your asanas, pranayamas, then hand gestures called mudras, then called your bandhas, and a sound called mantra. The function is lower part is the power. Second one is the procreation. Third one is the control. These are called animal instinct. When you come to the heart chakra, its function is called a love, big L-O-V-E, love. Throat chakra is a communication. Third eye chakra is the intellect. And crown chakra is your bliss.
Quick question, really quick, sorry. What are the different, why do they all have different petals? Like why different numbers for different chakras?
I was wondering the same thing, yeah.
Exactly. If you look at that, these are not present in your physical body. This is in a subtle body, and this numbers of petal represents the ascending order of the petals. 4, 6, 10, 12, 16. And when it comes to the two petals here, there's a horizontal, then got 1,000 petals. And this, the word, the Sanskrit word is called Kundalini Jagaran. Kundalini Jagaran means you have a power at the root chakra which slowly ascends up to a spiritual chakra. This is really the body, the lower three actually the body. In fact, the way they describe is, we have the 5 elements made our body. So the lower chakra is the earth element. Pelvic chakra is your water element. Belly button chakra is your fire element. Heart chakra is your air element. Throat chakra is your space element. And the third eye chakra is your mind. And crown chakra is a spirit. Body, mind, spirit, 5 elements and ascending order. And the way it was being described, this has been described thousands and thousands of years ago, and we get so mesmerized looking at it and studying it, that how did they visualize at the time that there is a potential energy in our spine? If people say, I felt, just to say that a snake is moving in the spine, I felt that energy in my spine. So it is all the ascending order of the petals. And if you look at a color, it's the same sequence as your rainbow: violet, indigo, blue, green, yellow, orange, red. Musculoskeletal system, reproductive system, gastrointestinal system, cardiovascular system, your respiratory system, endocrine system, nervous system. So the asanas which balance it, the one which is the root chakra, grounding poses. You can sit down the way you did in the morning, the grounding poses, cross-legged poses, Sukhasana, Siddhasana, easy pose, perfect pose. You can a lotus pose, or you can your like a thunderbolt pose. One in your pelvic chakra is your squatting poses. One at your belly button, you do the spinal twist. We call it vakrasana, spinal twist. You put your 1 foot together, put your hand in as the spinal twist. Chest, after there will be chest opening poses, the cobra pose. Here in the throat will be neck relaxation, the movement of the neck we did for posture of the neck. Did. Here in third chakras, generally we do the called a child's pose, balasana, or your rabbit pose, shashanka asana. And for the spirit, your crown chakra, the headstand. A lot of mudras are there, a lot of bandhas are there. Could talk about it. Let's do the prana. Oh, and then there is a sound mantra. Lam, vam, ram, Yam, Hum, Sham, Om. There's the 7 sounds we're going to do, the 7 chakras. We'll finish our practice today. Before that, let's do some pranayama practice, and we'll see the pranayamas are also connected to the 7 chakras. Hand mudras are connected to the chakras, and when you do it, we'll go by chakra. This is called therapeutic meditation. And if you can remember any of this, they're all in my book. So all of you have my book, it is there. Chakra Awakening Meditation and all the chakras. The first pranayama is your lung is like a balloon. It has a 4.5 liter capacity. We only breathe 0.5 cc. So first to relaxation, you relax your upper part of the body, relax your neck, and I showed it to you, and then keep your spine straight. Like this is the chair I have. This is called a kneeling stool. Very nice, for the computer. I always keep my spine straight. I'm doing the computer work. I'm doing my straight. I'm actually in front of my desktop. In the morning, I do another side of the room. That was my laptop. So always keep your spine straight. Sit in a chair if you need a support, or sit against a wall, keep your support. So breathing out first, then you breathe in, breathe out longer than breathing in. With your practice, like if you touch your index finger and thumbs, it's called meditation mudra, put it in the knees, you breathe out first. So breathe in very simply, count of 2 in, count of 4 out. 1 and 2 in, 1 and 2 and a 3 and a 4 out. Always exhalation longer than inhalation. You can slowly keep increasing. We've been doing it for so long. We can do it 10 seconds in, 20 seconds out. But for you, it will take some time. So say I'm very easily, I can do 5 seconds in, 10 seconds out. I breathe out first. And I can keep on going slowly and slowly, but always do completely effortlessly. First one is called a bellows, Bastrika. Normally, our inhalation is active, exhalation is passive. All the inhalation is done through your nose. Your nose is like your personal air conditioner. When the air goes in through your nose, the air gets filtered. Outside air is warm, it will cool it down. Outside is cool, it will warm it up. It goes along the side of the nostril and the whole the air goes into your lung. But if you breathe through your mouth, you don't know where the air has gone to the stomach or in the lung. If you at all have to breathe through your mouth, you can breathe in through your nostril, breathe out through your mouth. But also still, you have a muscles of expiration, muscles of inhalation, inhalation. You need to train all of them. Active inhalation, passive exhalation. Bellows is the one you do it for your, say, fireplace. Now, if you're in a city boy, city girl, you never seen a bellows, but I have a bellows with me. I show it to everybody. So it will be active inhalation, active exhalation. You can do a lot of ways. You can do very simply, sitting down, you can do. Slowly, you can even increase your rate. I keep on doing it. I do it every single day. I practice about 7 pranayamas every morning and do a lot of drainage, and I do a neti part, wash my nose every single day. You can do it raising your hands high up. I can breathe it out very slowly. When you pull it down, do it like a baby fist. You know, the baby fist, it relaxes. You can do a medium pace. You can do very faster pace. How long you do it? As long you have an F, there's no effort in breathing. Slowly and slowly build up. I'm just showing the technique. And really, after a meal, you should not do it. And I'm just showing it to you. And that's why we're not going to do the practice, proper practice, because we need to do about 3-4 hours. And also we said, we practice what we preach. Most of you have a good lunch, including me. I also had a good lunch. So I'm just going to show it to you. Generally practice, we do it for about 3 to 4 minutes of this bellows. Very good for disease in the lung, asthma, COPD, and pulmonary fibrosis. I have one whole YouTube video about the pranayama practice. It's a 2 hours, a bit long video, and I think I have this called a pranayama for COVID-19, I think, but you can take a look at it. I have all of them in my book.
So,
Going against the, go ahead. I'm listening.
sorry, I was gonna ask about the bellow breathing. Is that gonna engage your parasympathetic or your sympathetic nervous system?
So this is what happens. This is initially when you do it, if you do it very rapidly, it is sympathetic. But when you do it like effortlessly, it is your parasympathetic, but it's more what it does. It's called hyperventilation syndrome. A hyperventilation syndrome, the dirty carbon dioxide, what is the dirt, is all coming out and the fresh oxygen is coming in. When the fresh oxygen comes in, it is a relaxation response. Always remember to do this pranayama as if it is your normal breathing. How do you know? You can talk, you can even sing. Like here, whatever I'm doing, in fact, even if I do asana practice, I'm in total in a relaxation response. The total pranayama practice is a relaxation response, done properly. The moment you do it a little faster, you're creating a sympathetic overdrive. People say, when I'm doing this Kapalbhati pranayama, my blood sugar never comes down, my heart rate doesn't come down. You're too fast, too rapid. Yeah, yogis do it, but yogis do it, been doing it for so long, been practicing. Say for me, I'll be doing as fast as possible, but still I'm in a parasympathetic mode. Why? I've been practicing for a long time. Next one is called the breath of fire. The Sanskrit name is called a Kapal Bhati Pranayam. Kapal means forehead, Bhati is a shining. So what happened, we have an inner fire within us called the digestive fire. We have a one balloon here in our stomach. Then we have is a diaphragm here. Then we have another balloon here. Our awareness in my belly button, I push the belly button to the back and all the air comes out. I don't want to practice too much, as I said, we just had a lunch. So we like to do this in an empty stomach. But the way it is, it pushes in, it hits the diaphragm, hits the lung, and all the dirty, toxic material in the lung comes out. It's a detoxifying pranayama. When the detoxifying takes place, the body is glowing. That's what it's called. You have a light around your face. This is a very important because it massages all the internal organs. Massages your heart, your liver, massages your stomach, massages your spleen. And when you do it, I do with a hand mudras. This is called your meditation mudra, dhanu mudra. It really quiets down your mind. You bring your index finger down. It's called a vayu mudra. It controls your pain. This is called a shunya mudra. It controls your hearing. Hearing gets better. This is called a prithvi mudra. It controls your grounding element, like a diabetes, truncal obesity. This is called a varun mudra. It controls your bladder, the water content. So I do touch one, and I'll keep on doing it, maybe about 30, 40, 50 of them. My eyes are closed. Very quietly, I do it. It also massages your diaphragm, massages your lung, even also massages your heart from inside. And this ignites your digestive fire. So it is very good for your digestion. So also what it is, this pranayama, called the Kapalbhati pranayama, it also causes the ascending of the chakras. So when you do it from the lower chakra, it will come to the middle chakra and will come to your solar plexus chakra. Very, very important concept that the ascending of the chakras is going up through your root chakra, ascends to your crown chakra. That is your healing power. Third one is called alternate nostril breathing. Left nostril is controlled by the right brain. Right nostril is controlled by the left brain. Left nostril is cooling. Right side of the brain is intuitive. It is female. It is cooling. So left nostril breathing is called your moon energy, cooling energy. Right nostril is controlled by your left brain. Left brain is heating. Left brain is made. Left brain analytical. Right nostril breathing is called your sun energy, heating energy. I use the lower part of my thumb to close my right nostril. I have my eyes closed, keep my spine straight, and do a little touch my index finger and thumb, pull it on my left nostril, left knee. Breathe out through the left nostril first. Breathe in through the left nostril. Drop my hand down, close my left nostril, breathe out through the right nostril. Breathe in through the right nostril. Close the right nostril, breathe out through your left nostril. Keep doing alternate nostril breathing. Slowly you put your middle finger and index finger in between eyebrows. Close your eyes, bring your awareness to your third eye, and also keep a balance. You take your left hand, hold on to your right earlobe. This is called a super brain yoga. When you cross your hand and hold the earlobe, you balance yourself and you do alternate nostril breathing. So continue initially unless you have a little bit of any effort, and then you do it for between 5 to 10 minutes. 25 minutes of pranayama. This is the three main basic pranayama. The first one you do between 3 to 4 minutes. It is called the bellows or Bastrika. Kapalbhati pranayama, you do between 5 to 10 minutes, but that's your target. That's not today. And this is called a metabolic pranayama. Here it activates both sides of your brain. It brings your focus back. It's very good for your bringing your memory back. Very good for your dementia, Alzheimer's disease, and a powerful pranayama for your hypertension, neuropsychiatric disorders. You can practice a little bit of breath holding, and there are some called locks. When you take your chin, bring the chin down, touch your chest. It's called a chin lock. And chin lock, it really massages the side of the neck. There is a two organ called your carotid sinuses. Carotid sinus activate parasympathetic tone. So putting the chin down, it activates a parasympathetic tone. Same way, if you suck your stomach in, the way to do it, you breathe out first. Take a deep breath in, completely breathe out, suck your stomach in and hold. It's an abdominal lock. Very important, abdominal lock, chin lock. And also what you can do when you breathe out, you contract your pelvic floor, pull it up. That is called a root lock. So when you bring the pranayamas, when it comes to your, say, your heart chakra, which is the element of the air, you do alternate nostril breathing. The alternate nostril breathing will balance your heart chakra. Then you do the next pranayama, will be your, say, Ujjayi pranayam. Ujjayi pranayam is trying to close your throat and slowly trying to breathe in, and it stimulates the two nerves in the larynx, called superior and inferior laryngeal nerve. They are the branch of the vagus nerve. So they stimulate your parasympathetic activation. Also, the impulse goes to your lower part of the brain, called brainstem, and the signal comes out. It supplies your soft palate. The soft palate, you get a snoring. And then a sleep apnea, your tongue falls back. When you're sleeping, the tongue falls back and you get an apnea. They cannot breathe. Sleep apnea, you get a tremendous fear. It is the root cause of most of our lifestyle-related disorders, diabetes, hypertension, heart disease, high cholesterol. So the Ujjayi pranayam corrects your sleep apnea. So the way to do it is that first, you breathe out first. Also, during Ujjayi pranayama, you incorporate a chin lock, slowly bring your chin down. This also creates activation of your parasympathetic tone, which is very cooling. And then you breathe out through your left nostril, which is a parasympathetic side. Remember, left nostril is parasympathetic, right nostril is sympathetic. Let me show you one, and this will activate your throat chakra. For throat chakra, we'll do this pranayama called your Ujjayi pranayama. So breathe out first. Take a deep breath in. Completely breathe out. It's a wonderful, relaxing pranayama. It is so relaxing, it's called the Murcha pranayama. Murcha means you're almost unconscious. You feel like you are unconscious. It's very good to balance your throat chakra. To quiet down your mind, you close down all the five senses, then you create another vibration. And yoga, the vibration is, one is called Om. Om has a three component, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So what you do, this is called a bumblebee breathing. In a bumblebee breathing, instead of the Om sound, you do a sound of a bumblebee. But again, these are frequency. So the brain has a frequency, two frequency interacts, and it cancels. It's called harmonic resonance. So the bumblebee breathing, Bhramari pranayam, and also the Om. Om pranayam means you breathe in, when you breathe out at the sound of a Om, and I'll show it to you. Those will be your balancing the sixth chakra, Agga chakra. So here you are, put your index finger in between your eyebrows, three finger, close your eyes, with your thumb close your ear, and close your mouth. Breathe out through your nose first. Take a deep breath through your nose and breathe out with the sound of a bumblebee. Another relaxing goes pumping and cupping. Take your both the hands, keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take the hand like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your ear. It's very important. Back of the ear, front of the ear, in the ear canal. Because there is a called auricular branch of the vagus nerve. It initiates parasympathetic activation. Massage your front of the neck. It massages your carotid sinus, massages your back. Called bumblebee breathing, Brahmi pranayam. A lot of other pranayams for that. Called Savitri pranayam, your Sitali pranayam, Sitkari cooling. So one pranayam is called Om. So the way to the Om pranayam is that you'll breathe out first, take a deep breath in, breathe out with the sound of an Om. And then there is another pranayam called a Pranavo, P-R-A-N-A-V-O, Pranavo pranayam, which will do it for your crown chakra. The same Om pranayam with the three components separately, with three hand mudras. There's a name. This is called the touch. Put your hand down. It's called a chin mudra. It opens the lower part of the lung. If you close your hand like this is called a Chinmayi mudra. It opens the middle part of the lung. And if you do the baby fist, it opens the upper part of the lung. So we'll do it. Let me show it to you, these two pranayams, so you will know what is. First is the Om pranayam for your sixth chakra. You breathe out first. Take a deep breath in. We'll take a deep breath in and we'll breathe out with the sound of the Om. Oh. You say we always breathe through your nostril, but we do breathe through your mouth for calling cooling effect, cooling pranayam. This cooling effect is called Sitali pranayam, it's cooling, like people have a heart disease, people who has a pitta type of body type. And then you can bring it through your teeth called Sitkari pranayam. Again, put your hand like your baby fist. It's a very nice cooling. Then what you do, you stick your tongue out, breathe through your rolled tongue, close your mouth, breathe out through your nose. Sometimes you said you cannot stick your tongue out. You do with through your teeth. Sitkari pranayam. Like the way you do it is the teeth. They're called the mudras, very simple mudras to balance all the chakras. So in the lower chakra is your earth element. In the earth element, you touch your ring finger thumb, it is called your Prithvi mudra. That is a mudra for your earth element. Pelvic chakra is a water element. Touch your little finger and thumb, called a Varun mudra. Your solar plexus chakra is the fire element. Fire is called your digestion mudra. Is called Apana mudra. Middle finger, ring finger, and thumb. This is fire element to balance the chakras. Mudras. The heart is called your air element. Air element. You take the index finger down, put your thumb in the top. This is called a Vayu mudra. This is to balance your heart element. Throat chakra is a space. You touch a middle finger and thumb. This is your called your Shunya mudra, balances your throat chakra. For your sixth chakra and the crown chakra, you do what is called your Dhyana mudra or meditation mudra. You do this mudra to balance those chakras. Very important. So for the lower two chakras, you do your root lock. For here is called your abdominal lock, the third chakra, and a fourth chakra. Remember, it's ascending the power of the chakras. From the throat, you do your called your chin lock. For sixth, called your chin lock. And for the ground, you do all the three together. It's called a great lock. The way to do the great lock is a very nice way to do it. First, you breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. I'm not sucking in too much because I had some food, just to showing it to you. Suck your stomach in and hold. Then contract your pelvic floor and pull it up. And slowly drop your chin down. Touch your chin to the chest. And stay in this posture. It's called a great lock. It's a wonderful practice. Any question what we have done by now? These are all recorded. You will get the recording and you will see all of them. You can go back and see. And I have all of them in my YouTube channel. You can see. So I see the face of Ellen. Hi, nice seeing you. And nobody else wants to show their faces, but I hope they're doing the practice. Hey. Tiffany, who else? Brianna is here. Oh, she's an iPhone. Jamie, who else is here? All right. Okay, we're going to finish. It's called your Chakra Awakening Meditation, the sound. Okay. The steps will be, okay, see the Jamie's face too? Very nice. You will keep your spine straight, have your eyes closed. Your hand will do this mudra, it's very quieting mudra. Then you'll be doing the sounds because sounds balances those chakras. The sounds will be Lam, the lower chakras, Vam, next one, Ram, third one, Yam, fourth one, Hum, fifth one, Sham, sixth one, and Om. Om has a three components, A, U, Ma, that is called a Pranabho Pranayam. P-R-A-N-A-V-A, Pranabho Pranayam. We'll finish with that. And this will be this is called your therapeutic meditation. Like if you have a disease of a system or an organ, you will be doing all the 7 meditation of the chakras, but you'll be doing more on that chakra which is involved. So for me, I have a heart disease, I'll be doing a little bit more on my heart chakra. If you have a lung disease, you'll do more on your throat chakra. If you have a thyroid problem, thyroid issue, you'll do more on your sixth chakra. You have a reproductive issue, reproductive organ, you'll be doing more from your pelvic chakra. If a musculoskeletal system, if a back pain, knee pain, hip pain, you'll do more from your root chakra. Neuropsychiatric disorder, you do more on the crown chakra. So let's start. If you all want to do, we will finish with this. And this is called your chakra awakening meditation. As I said, chakra can be awakened with your asanas, pranayamas, mudras, the bandhas are the locks, and the vibration, the mantras. Eyes is closed, your hand touching your index finger and thumb. This is another very fascinating thing about mudras. When you first do the mudras, you'll see your hand is a little bit of a curl like this. And fine, don't try to make it straight, because it never makes it. But if you keep it the same way and keep practicing relaxation slowly and slowly, your hands will drop down, become straight without knowing. Your mudra will be like this, and that tells you. Same way I think I showed you in the morning, you will have some saliva in your mouth. When you get sympathetic, when you get scared, your mouth becomes dry. Your parasympathetic, mouth becomes very wet. Index finger and thumb gently put over your knees. Close your eyes, keep your spine straight. Bring your awareness to the root of the spine. Visualize there is a wheel, it's a chakra, red in color. 4 petals, it's in imbalance. It's connected to your musculoskeletal system. Function is the power, and balancing sound is a lum. I will be doing the sound, and if you want to do with me, you're welcome, or you can do it silently, but you can do the sound. And also your nose, I'll breathe out first, breathe through my nose, and then the sound will come out. So breathe out first, take a deep breath in. Lam. Bring your awareness between belly button and the root of the spine, behind your pubic bone. This is your pelvic chakra, called Svadhisthana chakra. Orange in color, 6 petals connected to your reproductive system, also connected to your gonads, testicles and ovaries, and connected to your pelvic plexus. Balance the chakra, the sound is a VAM, V like a victory. So breathe out first. Take a deep breath in. VAM. Bring your awareness to your belly button, solar plexus chakra, Manipur chakra. Yellow in color, 10 petals connected to gastrointestinal system, also connected to the endocrine glands of the pancreas and solar plexus. Sound to balance the chakra is rum, or like Robert. So breathe out first. A deep breath in. Rum. Bring your awareness to the level of the heart chakra. Color is green. 12 petals connected to cardiovascular system, connected to thymus gland, and also cardiac plexus. Sound to balance the chakra is yum, while like yellow. So breathe out first. Deep breath in. Yum. Bring your awareness to the level of the throat chakra. Color is blue. 16 petals connected to respiratory system. Function is communication. Connected to thyroid, parathyroid gland, and connected to a pharyngeal plexus. Sound to balance the chakra is hum, H like in Harry. So breathe out first. Take a deep breath in. Hum. Bring your awareness to your third eye, in between your eyebrows. Third eye chakra, sixth chakra, Agga chakra. Color is indigo. There's 2 petals connected to your endocrine system. Connected to a pituitary gland, connected to your vagus nerve, parasympathetic tone. Sound to balance the chakra is a shum, S-H. Again, breathe out first. A deep breath in. Shum. Bring your awareness to the crown chakra. Color is violet. 1,000 petals connected to nervous system. Function is your bliss. Connected to pineal gland and also the cortex of your brain. Here to balance the sound is Om. Om has three components, A, U, Ma. And we will call it Pranavo Pranayam, P-R-A-N-A-V, Pranavo Pranayam. We'll do the 3 times. We'll do A with this mudra, touching your index, but hand turning down. It's called a Chin Mudra. U will do closing your hands, called a Chinmay Mudra. Ma will put your thumb inside, called a Adhi Mudra. So touch your index finger and thumb, put it gently over your knees with the hand down. Breathe out first. Take a deep breath in. Change your hand to Chin Mudra. Put it over here. So, ooh. Breathe out first. Deep breath in. Oh. Change your hand to Adhi Mudra. This will be your Ma. Breathe out first. Take a deep breath in. Slowly bring your hands in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger, and index finger. It's called a lotus mudra. It connects your body, mind, and spirit. Slowly bring it close to your heart. Your heart is the site of your soul. And once you have corrected the programmer, the soul is I. Looking inside yourself, self-realization. When you find who am I then program your software, which is mind, control your mind. The software controls your body, which is your hardware. So you get the complete healing of your body, mind, and spirit with yoga practice. Yoga gives us wellness, physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Put your hands again in front of you and then bow your head down. Yogic tradition is called Namaste. Namaste means I honor the divinity within you. You are divine. We are all healed. You are healed. Finally, finish again with thumbing and cupping. You rub your hands, rub your hands. And you feel the warmth in your hands. If you're wearing glasses, remove your glasses. Take the hand like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Slowly massage your forehead, massage your eyes, massage your face, massage your ear in the back, in the front, in the ear canal. Then slowly bring it down. Massage your carotid sinuses, massage your back. Open your mouth. It's a wonderful practice. time is just gone. 4:30 now, the time we're going to finish. We did a lot of material we covered, and generally that's what we covered in the yoga teachers training, but they're all in the manual, and my one is all in my book. You can take a look at it. You can ask a question. If you want to find me, I'm easily available. You can go to my website, my full name called Dilip Sarkar, DILIP SARKR.com. I have my email address there. And when I will share the slides, you'll see bottom of the slides, I have my email address, my phone number, all my information are there. Connect me. If you have any question, you can call me, shoot me email, send me a text. I'll be glad to answer for you. If you have any question, I'll be glad to answer. Wish you the best for your journey, finishing your course at the end of this year. I hope by that time, hope this is a pandemic, so we can come, we can get together again. Any questions from you, any of you? Or any of the closing comments? Anything you want to tell us? We have been telling you.
I actually like that last part, with the, I've never done like a chakra meditation kind of thing. I like that, like the breathing and all that, so.
Beautiful. This is the therapeutic. You see, when you have a disease of an system, so if you have a, say, irritable bowel syndrome, or if you have a, say, gastroesophageal reflux, you meditate more on this, your solar plexus chakra. So if you have a thyroid problem, you meditate more on this, third eye chakra. If you have a neuropsychiatric disorder, you have multiple sclerosis, or you have a Parkinson's disease, you meditate on this, the crown chakra. It's a very, very easy way to remember as a yoga therapist. And by years and years of experience, we have designed this. You will never find it anywhere. This is never find it one place. In my book, at least, I put it all together. But all my videos, you have it. I have a lot of videos, on the YouTube, we'll see for meditation. And one video is completely on the chakra awakening meditation. What are the asanas? What are the pranayamas? What are the mudras, bandhas, and kriyas? Okay, I think if you don't have any more comments, any questions, have anything else you have?
Just wanted to say thanks.
Just thanks, there's nothing. These are our, we call it community service. We want to share. I really don't teach. I said I share my practice. I share my experience with all of you, so you can carry with you, keep the flag of yoga flying, flag of yoga therapy flying. We won't be here that long,